This evening, I'm pleased to see so many of us in attendance. Just to let you know that this meeting is being filmed and recorded and will be put out on the Council's site for viewings to the public. So just to let you know, by entering the room, you are agreeing to be recorded and videoed. It's all, hopefully you've got a copy of the agenda. If not, we may have some spare ones as copies, spare copies. Apologies for absence, Dominic.
Yes, no apologies. We have everybody here, I think. Just Councillor Peacock is appearing online.
Thank you. Any items of urgent business?
No, none received.
Declarations of interest. Helena?
So just, I mean, I don't know how much of interest it is, but I am co-chair of the Joint Partnership Board, and the deputation might feel I have some interest in this, but that's it.
Okay, I always say that my sister's GP in Tottenham and I'm a member of the RCN. Anyone else got anything they want to put down? Councillor Mason?
I'm a trustee of Bridge Trust.
Right, deputations. Okay, so we're going straight over this evening to deputation, which has come to our panel on behalf of Osborne Grove Nursing Home. We've got a number of you here this evening. So I'm Councillor Pippa Connor and I chair this Adults and Health meeting. The members of the committee will just introduce themselves, and then if you'd like to introduce yourselves, and then we'll go into the deputation.
Good evening, everyone. Ty Karan, Labour member for Woodside.
Good evening. I'm Sean O'Donovan. I'm councillor for Tottenham Hale.
I'm Felicia Poku. I'm a councillor for Tottenham Central Ward.
I'm Mary Mason. I'm councillor for Bounce Green Ward.
Cathy Brennan, councillor for Muswell Hill.
Helen Akania, co-optee.
Can I say Councillor Sheila Peacock from South Tottenham Ward?
You can, Sheila. Thank you. Did not mean to miss you out there. It was just straight in. Okay. Thank you. Gordon, if you put your mic on, then you'll probably be able to pick up.
I'm Gordon Peters from the Haringey Over 50s Forum.
My name is Mary Langan. I'm the chair of the Severe and Complex Autism and Learning Disabilities Reference Group.
I'm Anne Gray of the Older People's Reference Group and also the Over 50s Forum.
I'm Sharon Grant. I'm chair of Health Watch in Haringey and also co-chair of the Joint Partnership Board.
Peter, did you want to introduce yourself again with the mic on? You can use Helena's if you like.
Oh, sorry.
Vida Black, chair of Carers for All.
Excellent, thank you. Now, Dominic, how many minutes do we have for the...
We generally allow 15 minutes for deputation, so we suggest a 3-minute introduction and then questions and discussion for the rest of that.
Over to you, Gordon. And is anybody else wanting to speak as well as yourself?
Thank you. Yeah. Okay, I'll try and encapsulate in the 3 minutes, I hope, what Osborne Grove was about. I looked back and in 2017, that's 7 years ago now, a vision for Osborne Grove produced with a number of councillors and perhaps the first example of co-production and council officers as well, of a home of health and well-being that's integrated into local community life. That is the idea of recrudescing that site on the corner of Tollington Park and Stroud Green Road. If members here want to see any more detail, because I haven't got time to show it to you, please look at commonplace.osbornegrove and Google that, and all the work that was done, including the planning details of the future of Osborne Grove, will come up on that site. The work that was done until the recent pause. What I want to say is the Osborne Grove Nursing Home project has been developing since 2018 as a pioneering example of co-production between Haringey Council, the NHS in North Central London, and service users and carers alongside community representatives. It follows the saving of the site on the corner of Stroud Green Road and Upper Tollington Park from sale to developers after a successful campaign to retain such a facility of public value and for which there's a demonstrably high need. There is an established co-production steering group which has worked together on the design and plans for over 5 years with due consideration of scale, environmental impact, community interaction, neighbourhood integrity, as well as creating a multi-function facility appropriate to the needs of vulnerable people and a meeting place for local residents and visitors, all on one site, not separate and the residential out of sight and out of mind, but all on one site and integrated with locality. Key point. The project design has been altered and reduced in size to take account of resident and service need feedback and was ready to seek planning permission for build and completion within 2 years when it was paused earlier in 2023. The case for Osborne Grove has been well made, and indeed the Cabinet approved it in 2019, and it was ready to proceed prior to the pause brought about in the 2024-25 budget making. In brief, the site, once re-provided, will give at least 70, possibly more, 24/7 places for elders in need of nursing care in a high-quality facility and people with learning disabilities who would otherwise be placed outside the borough, potentially much further away and at greater risk of isolation. It would also establish a flagship local resource with preventive health facilities of daycare and rehab from hospital and community space with street-facing cafe, all on the one site. It would reduce the longer-term financial burden to the council of having to place vulnerable elders and people with disabilities in privately run facilities elsewhere, and with less oversight and costs out with the council's control. The income from placing people with learning disabilities and older people with high needs in full-time care is a guaranteed return on capital investment and helps respond to the projection of significantly rising need. So if you ever wanted an investment that's a safe one, this is the one to go for. As petitioners, we are now particularly concerned that with the announced pause in the Osborne Grove project and without any firm commitment from the council that it will recommence either in 25-26 or 26-27, that other issues and firefighting financial crises will relegate it altogether. As trust has been severely tested by the recent actions and non-actions of the council with regard to Osborne, and the dearth of communication through most of 2023 compared with earlier years, we have little, if any, faith that the future capital budget allocations will indeed remain. We also believe that the council has not exhausted its capacity to borrow capital funds. And we're very disappointed that any cost-benefit studies and working assumptions on the design and a redesign of Osborne have not been shared with us, i.e. the co-production steering group. The 2022-26 Haringey Labour Manifesto, Building a Fairer and Greener Borough, promises locally delivered care by default as part of our 20-minute neighbourhoods. The introduction by Council Leader Perai Amit proclaims a Haringey local deal that puts residents at the heart of everything we do and promises to empower our communities. A section on the theme of people power promises not to do things to you, but work with you. The co-production that we have pioneered. We ask, therefore, that this committee demand of the council 4 things. 1, Osborne Grove is made a priority within its medium-term financial strategy. Whatever the short-term difficulties, and we acknowledge they are extreme in the current financial environment, the medium and longer-term financial strategy should not be abandoned or put on hold when so much is involved in the future of vulnerable people who are at risk. Secondly, the full cost benefit analysis of a redesigned facility should be made and revealed to the stakeholders to include capital and revenue costs and income earning potential of the facility against revenue costs of doing nothing. And please remember that the residents of a nursing home bring with them money per head, whether they're privately paid for, NHS paid for, or local authority paid for. So there is a guaranteed income there. The co-production steering group, thirdly, should be reconvened, and it hasn't met for almost a year, before the end of the 2023-4 cycle. That's between now and sometime in April, with an updated timetable for implementation of the project. It shouldn't be put on hold. The steering group must meet, and we want a timetable, and we want the cost-benefit analysis in front of us. And fourthly, we say that the council should issue a statement in relation to Osborne Grove that this in-house provision, cost effective as it is part of its continuing strategy for health and social care in the borough, and that it recognises that if co-production is to succeed, the trust of all local partners will have to be rekindled. There is almost 7 years of exemplary work at stake here, and it's all on record, and the plans and the statements are all there, including by leading councillors over the last 7 years. If you renege on this now, you go back on all of that. What trust will be left? We can answer questions on the finances and other things if members have, but I think Mary wants to say something as well.
I won't take long because I think Gordon's summarised our position very cogently. I did just want, though, to draw attention to one thing in the statement about Haringey's commitment to people power. Its commitment, the Labour Party manifesto, the last manifesto, is commitment to co-production and working with grassroots members in the community, people like ourselves, and to not do things to you but work with you. And that's a direct quote, obviously, from that commitment by the council. I think the fact that we are here today is the co-production group that worked for 5 years on this project, and we, like all people in our position, that commitment is given freely, enthusiastically, and with no pay. Our disappointment is that we are here now as petitioners, not as members of a co-production group. We've been reduced to being petitioners on a project that we worked faithfully on for 5 years and longer, as Gordon has pointed out. I think it then casts some doubt on the wider commitment of Haringey to co-production as something that it promotes as a principle that it works around and is faithful and loyal to. That, of course, is being completely cast into doubt by the way in which this the recent events around Osborne Grove have been handled. There's been no attempt at co-producing or partnership or even providing information that's at all helpful to us. Any information that we've got, we've had to request. It's been eked out in tiny, tiny portions that's difficult to comprehend and certainly hard to explore and work with. It's a completely different relationship from that which we enjoyed, and I would say enjoyed because we entered into a relationship with colleagues in the co-production group that was productive and did produce some incredible work, as Gordon has pointed out, and that which you can find a record of on common ground. So I did just want to draw attention to that wider issue of the anxiety about what is the relationship now between Haringey Council and those with whom it says it has a relationship of not to do things to you but work with you.
Okay, thank you so much for everyone that you've come today to speak to us, Mary and Gordon in particular. I know it's always hard to sort of come and speak in front of a committee room. So this is an opportunity now. I'm already seeing members putting their hands up for us as members to ask you questions about what you've come to speak to us about today. And at the end of that, the committee will look to sort of explore that further, and at the end make recommendations following this discussion. So I've got Councillor Brennan, and then I've got Councillor Mason, and I'll start with those two. Thank you.
So I wanted to ask you about the co-production. So I understood it was going really well for a long time and it worked really. So exactly how did it happen? I'm interested. Did you suddenly stop receiving any contact? You just stopped? A year ago you just didn't hear anything? As if it had never been?
Well, in fairness to Councillor Desneves, and as the cabinet member, I think she circulated us to say there would have to be, I can't remember the exact words, but a pause. We couldn't have a full meeting. There would be a 1-hour meeting at the end of January with Vicky, who was a senior officer, and that was what was offered. That was all that was offered, a short explanation meeting.
How long did you waited? How long did you have a pause before you had that? Prior to that, or is it just?
I think from February till November, something like that.
So basically, because I'm just interested on the communication side, because I always feel we should really keep people informed, and it sounds like we sort of let ourselves down a bit on working together.
And I thank you for your presentation. I'm particularly interested in two areas. I'm concerned about the area that Councillor Brennan raised, but I'm interested in the following two areas. One is that you said that you felt that it was affordable and that the council could have borrowed money. I think you are aware, as we all are, that the council is in huge financial difficulties, as are councils across the country. And so I wanted to follow up on that and ask you a bit more detail about that. I also wanted to know, I mean, we have had a policy of bringing services back into the borough, but can you please just give us a very brief outline of why you think that's so important? Thank you.
That's when you do the second one. Okay, on the affordability, I think our position is you have to take at least a medium-term perspective, because the people coming into a nursing home, and they will increase in terms of need. There's no equivocation about that. Take a while to assess, and then they take a while to place, and it's often a year or more before they actually come into the place they might have been looking for. So if you look forward to 2025-6, say, 2 years from now, that's when we think a nursing home should be, again, going through the whole process of being built and got ready. It would have been got ready by then. There would have been a year or two during which there's a gap, undoubtedly, in income until you fill up the building. But 70 residents, 80 residents, or whatever the number is, bring the income with them. The cost-benefit issue is about which is the most expensive. Is this going to be more expensive or less expensive than the average? And if it's more expensive than the average, how do you get the income to match that? So that's why we need the revenue accounts. We need to look at cost benefit, because we can't measure the potential income of the number of residents against the most likely scenario of year-round revenue and outgoings that the council will have until we see that. So I can't give you a definitive answer. But because people bring with them money per head before they get a place, the places are guaranteed and the money is guaranteed. Whether or not it's enough depends on the nature of the business. Some private businesses charge huge money, over £1,600 a time, rather than 900. So there's a huge variation in costs. Yes, that's why we need to go into that. But the revenue is potentially there, and that's why we want to see it. On the capital borrowing, local authorities still have preferential capital borrowing rights. Not as good as they once were when I was a director, but they're still there. And they can borrow, and they could partner with the NHS, who are very keen for this establishment to go ahead because it has bed capacity influence on them. And they could partner with other partners who might be willing to put up capital alongside the capital borrowing. That needs to be explored. but for such a going concern as an older person's residential facility, along with the community costs, they would be additional, yes, but the residential facility is guaranteed. Why not borrow the capital to make sure that comes about? Because you don't build anything if you don't borrow. So the council can borrow.
Sorry, can I just ask you about the finance just a bit more? So you were aware, and it was brought to the committee, the financial information prior to the last year. So you were aware of the figures, the projections, the cost-benefit issues that were being addressed as you as a group moved forward with the plan. Is that correct or not?
We were never fully aware of all the information and costs and benefits. We had some partial information. We had the kind of information that's nationally available, right, you know, on what beds in Greater London and North London, in Bedfordshire and elsewhere cost. But what we are completely convinced of is that sending somebody to a private home in Norfolk or even in Bedfordshire at a cost which the council can't control can in no way be cost effective compared with an in-house provision.
Thank you.
Okay, thank you. I've got Councillor Peacock who wants to ask a question. I've also got one of our co-optees, Ali. Do you want to just say hello? Sorry, well, I missed you out to begin with because I couldn't see you on the screen. So do you just want to say hello and introduce yourself, and then Councillor Peacock, if you'd like to ask your question.
Sorry, Chair, sorry for dropping in, but Mary was about to respond to my second question.
Okay, so I'll still ask Ali to introduce herself anyway, and then Mary can answer that part, and then just Councillor Peacock.
Hello, good evening. I am Ali Amasyali, one of the co-optees.
Excellent, thank you, and apologies for missing you out earlier.
That's all right.
I missed you on the screen.
That's
okay,
right.
So apologies, Mary, you were going to answer the point of Councillor Mason. I'm going to ask, we've obviously got limited time for this, so I will need, because we have other questions from other members as well. So yeah, if we could just be a little bit brief, if that's all right, because I want to get everyone in. So Mary, and then Councillor Peacock, and then Councillor Donovan.
Councillor Mason touches upon the point about communication that Councillor Brennan raised, which is what information is provided to us. When the co-production group started and during the major part of its life, most information was shared with us in relation to numbers of people needing a provision like this, numbers of people going out of borough, numbers of people in borough, what the likely demand was from people in hospital beds. That sort of information was provided, usually in hard numbers. It's very difficult now for us to work out data because it's provided in percentage forms. We recently asked at the 1 hour meeting that Gordon mentioned that was offered to us as a way of providing us with at least an hour to talk. We received the information that 81% of people were in the North Central London footprint, and that 18% of people were outside of Haringey. I don't know what's happened to the final 1%, because that does leave 1% outstanding somewhere. But the North Central London footprint is not Haringey, it's Barnet, Camden, Enfield and Islington and Haringey. And we still don't have the information which we would like in hard numbers, not in percentage terms, to know who is actually placed in Haringey and who is actually in Barnet, Camden, Enfield and Islington. We know from our own information that people placed in Barnet and Enfield particularly have difficulties in relation to their family visits, to elderly spouses, to even have it to home visits, although obviously that gets less and less possible as people get more and more infirm. So the issue of where people are needs to be explored and needs to be shared with us. And certainly we need to identify the numbers of people actually in Haringey as opposed to what's now referred to as the North Central London footprint, which actually is not very meaningful in relation to getting a picture of where people are and how far they have to go And certainly we're worried about the people who are out of Haringey. The monitoring of the range of facilities that people go into is not robust in our view. It relies on the judge. It relies on there being a judgment of good attached to that particular facility. In our experience, that doesn't mean the facility is good. There is no robust monitoring of all of those facilities across the North Central London footprint or outside that we can rely on to assure us that the quality of provision is good. And that's of concern to us. A central facility like Osborne Grove, of course, would provide a robust, solid system inside the borough that could be regularly monitored, that everybody would know what was going on, that the quality could be assured, and that we wouldn't have to be worried about people out in Outer Enfield or Outer Barnet, where the only contact that there is that actually by the family.
Okay, thank you. I've got Councillor Peacock and then Councillor Donovan and then Helena. Actually, could you ask actually no, just Sheila and Councillor Donovan and then Helena, if you could ask your questions just so we can get them all in. Thank you.
I just wanted to ask, can you hear me?
Yes.
I just wanted to ask how many other London boroughs have nursing homes? And I'm quite interested in what Gordon said about the cost and that you're bringing money. I'm actually very involved with the extra care homes in the borough, and they work out the minimum of £800 a week. And I'm just wondering how much it would cost for a patient in the nursing home, because if they couldn't afford it, then the council would then have to pick up the tab. So perhaps Gordon could speak on those two items, please.
Okay, I'm not going to ask Gordon if he doesn't know the costings, to be fair, because he's here as the deputy rather than someone who would actually know all the figures. So I think we can hold that question over maybe to officers later if that's not known. And Councillor Donovan.
Okay, thank you, and thanks for the delegation, and thank you for all the work that you've done in relation to this. I mean, I well remember going back 7 or 8 years when there was a huge public campaign, widespread campaign to keep the site in public ownership, which has succeeded. Then obviously now is the use of the site. And again, thank you for all the work you've done subsequently in the co-production steering group, but also I want to thank the officers and the cabinet members, etc., who took part in that co-production steering group. Clearly, there's been some difficulties over the last year or so, which we hope we will get over. At the last meeting, we were told that there is a pause on all capital projects, so there will be a full review of those. I suppose the question is that will the co-production steering group be a full part of that review process? At the moment, it's in public use, the site, because it's a very valued, offers very valued accommodation for, I think, up to 34 very vulnerable people who have suffered homelessness. Street outreach team can refer rough sleepers there, people who have had mental or physical health or substance abuse are housed there, and that is a very important meanwhile use, temporary meanwhile use. And again, I suppose the question is how long is meanwhile and how long is temporary? Again, thank you. Sorry, the other thing I wanted to mention was although the work has been paused, the capital projects have been paused, Osborne Grove figures still appear on the medium-term financial strategy draft capital programme, which obviously runs up from this year up until 29. And I hope that is, well, I'm sure that is a commitment that a review will take place, and hopefully a positive review, because Osborne Grove does mean a lot to a lot of people in Haringey, and we want to keep it not just in public ownership, but as somewhere of a very important social infrastructure, used at the moment for homeless people, hopefully, I'm sure you're hoping in the future for as a nursing home for equally vulnerable older people. Thank you.
Okay, so a couple of those questions from Councillor Donovan, I know probably best addressed to officers, because that's a detail I think they would probably need to address, or the Cabinet member. So Gordon or Mary, do you want to answer the questions from Councillor Peacock and Councillor Donovan, and then we'll take Helena. Anyone got a last question on that? No? Okay, so Helena, after those two questions are answered. Helena, after.
Well, I take Councillor Donovan's remarks as basically supportive of keeping Osborne going, so I don't feel I need to respond beyond that. I very much hope you're right, and our force demand that the Council issue a statement as soon as possible to say not just what's in the budget currently stating something like 41 million is still there, but there is a statement accompanying that to say that that will not disappear. I think that would be what is useful, because things do change year by year, and we've seen that happen in the last year. So all the more reason for, in medium to longer term strategy, for the Council, please, to make a statement to say we won't drop this, yeah. And on the temporary use, I quite accept as much as anybody, I think, that homeless people need looking after, but it shouldn't be necessarily, they should not be without beds if it's temporarily at Osborne Grove, but it should not be something that becomes semi-permanent when there's a need for homeless accommodation across the borough. If there were to be a change of Osborne Grove, it would have to be a policy change, I would say. It would have to be by Cabinet, not by default. The homeless people do need looked after, and the Council must find ways of doing that. So we're not against the temporary use if the Council make these other statements about maintaining Osborne Grove in the medium-term strategy. Basically, that's what I want to say.
Thank you. I think we'll pick up Councillor Peacock's question as maybe a response back on the finances. So Helena, do you want to ask a question, and then that'll be the last?
Okay, so
I did ask about how many other boroughs have got nursing homes, and he hasn't answered that one.
If he hasn't got any, sorry, Sheila, just Councillor Peacock.
How many other London boroughs actually the councils run a nursing home?
So I think yes. So Gordon, do you know of any other borough-run nursing homes in London?
No, there are none other in the country. This is the only one in the country. All nursing homes are NHS, which is all the more reason to preserve a unique facility as a community integrated with nursing. As for the costs between 800 and much higher, I'm not in a position, officers might be, to say what the relative costs across London are. And that's a discussion we would like to have in an informed way.
That's absolutely fair enough. Thank you. Thanks, Councillor Peacock, for coming back in on that. Helena.
Thanks. I wanted to touch on some of the things that were in the deputation's statement, which do concern me for the future of co-production. Because if you don't take on board the things that have happened with Osborne Grove, what does that say about your relationship with any other groups that are going to come or try to come on board? Will they want to spend 5 years? I mean, that was a long time, and it looked so good. So I'd like to understand how you pull that trust back, because for me, I'm very worried. And yes, admittedly, it's because I'm co-chair of vulnerable groups, but actually for all the people in Haringey who might want to do some voluntary work, it would be nice for them to understand that they're going to actually be involved properly. So that's all I wanted to say.
No, thank you. I think there's quite a number of questions that have come up, and I think it's only right now to offer the opportunity for either officer or Councillor Neves, if they'd like to respond at this point before we just as a committee make our recommendations. There's a number of things I think pertinent.
Thank you, Chair. And I've got a response, a formal response, if you're happy for me to read that. Then there are probably just a couple of things that were questions or that came up that between myself and officers we might be able to respond to, if that's useful. We're all disappointed that the plans for the future nursing home at Osborne Grove have been put on pause. And I think we all wanted the same thing. First-class nursing care for residents in Haringey. More residents able to access high-quality care in the borough and reduced reliance on the private sector, which doesn't always feel like it's serving the public interest. The potential to reduce the amount of public money that leaves the borough also through commissioning care placements from the private sector. And we all worked in good faith to deliver on those shares aims. And we put a lot of time in and a lot of effort into that process. And I think as a deputation reflected, both themselves, but officers and the political administrations. So firstly, I'd like to put on record my thanks to every member of the co-production group who gave their time and their expertise, and also to staff who were involved over the years, and there were quite a few different people over that long time. The fact is, though, that the world has changed completely since this project started. The economy, the cost of providing care, construction costs, the costs of borrowing. Local health service structures have completely changed significantly, and so have the resources and priorities of our local health providers and partners. And it's completely true that the pandemic also slowed that process of the project too, and had a lot of impact and certainly contributed to some of those things that I've already mentioned that have been hugely earth-shattering for our whole environment and how we work. We tried desperately to keep the project going, and have spent months actually looking at how we could make it work, but we can't. So I felt in December we needed to be open and honest and right to the group and say that. Now we've got some time to think and some space to plan what next. The positive news is, as I think some of the committee have highlighted, is that during that period that we're thinking, we'll continue to use the site in the way that we have for the really important function of accommodation for homeless residents. That's something that was already in place, and we'll continue. And actually, Gordon's right, a recent cabinet decision secured that meanwhile use for that 2-year period of pause, and that's a hard stop at that point. So he's right, that's a cabinet decision. And that provision is really important, and it's really important to be able to use the space in a way that's important to many residents and of great concern. I guess I should address head-on what's happened in this case and it constituting a failure of co-production, as has been suggested. Now, I haven't personally been involved in this project all the way along, as others have. And I definitely know there are things that we could have done differently, and there are things that we've learned, and I think that's always the case. But what's really, really clear to me is that we've undertaken this work in good faith and the right intentions on both sides. And you're all right, it was a really exciting project and a really great example of innovation, and Gordon's highlighted that by saying there is no other facility like it in the country. And I think that's why we're all so passionate about it in the borough in the first place, right? But I know that no co-production project is perfect, but I don't think that any kind of work that we could have done together could negate what are just some of the huge and horrific economic circumstances that we're in at the moment. And I don't think most people, especially some of our most vulnerable and most struggling residents in the borough, needed anyone to tell them that we were in a recession. I think in the last year, everyone sat on the edge of it. And for many, many people in our borough, they have suffered enormously. And our budgets are struggling. And we might come back to some of the points about borrowing, the cost of borrowing, etc. So the reason that we're not proceeding as planned, that we're not carrying on, is simply because of those circumstances. They're economic, they're financial, they're difficult. I do have some specific responses, Chair, to each of the items in the deputation. Is that useful? So on the requests from the deputation, firstly on Osborne Grove being made a priority in the medium-term financial strategy, my response is a significant sum remains in the Council's capital programme for the future development of Osborne Grove Nursing Home. We now have 2 years to reflect with the knowledge that there are the resources available from 2027-28, subject to a business case. And it's important to say that this project started subject to a business case in 2019 that set out why it worked financially. And any project that we do in the council will always have that. And as I've set out, those circumstances changed for us. The second request was a full cost benefit analysis of a redesigned facility is made and revealed to stakeholders. Obviously, we're very happy to share the council's financial analysis, which sets out clearly the changes in the costs since 2019, including the increased cost of borrowing and construction. And I suppose at this point I could share, I made a couple of notes just on what I'm aware of, but of course we'll fully share our financial documentation. The three things I had was the cost of the projects has ballooned since 2019. That's to do with the cost of building work, to the cost of materials, etc. It's a very significant increase. The interest rates are very high compared to 2019, which would have built that business case back then. That impacts our cost of borrowing. And the cost of care and the placements has increased significantly also. And perhaps later on, John can talk a little bit to that issue about the money that people do or don't come with. So that was on item 2 in the deputation's requests. Item 3 was about the co-production steering group being reconvened for the 23-24 cycle. So, of course, we're planning to keep the co-production group working with us and informed, but we're not in a position to carry on co-production work since we've paused the project. We've committed to having regular updates, meeting regularly as appropriate in order to prepare and progress for that point at which hopefully we can come out of pause. And then request 4 was that we issue a statement in relation to Osborne Grove, excuse me, and that it's a key part of our continuing health and social care strategy, etc. And our response is that I'm happy to state here on record tonight that we remain absolutely committed to that shared vision of a local care system which provides high quality services to residents, provides maximum value for money, and where possible is provided by the public sector in the public interest, aligned with what are our values and the values of this administration. So I think that's my response.
Thank you, Councillor Snebs. Okay, so what I'm going to do now, because obviously we've gone well over the time for this deputation, but I think it was a very important item to sort of take. I think as a committee, I think if we make some recommendations here this evening, and at that point, Councillor Brennan, if you want to sort of put something forward as a recommendation, that would be really good. I know you had your hand up probably for a follow-up question. So I'll just start because I've just been listening to everything that's been said here this evening, and I think the bit for me that's come out is the word trust has come out a lot, and around putting a lot of time and effort into something, and then just wanting to be a partner at the point when things aren't going so well as when the times were going okay and everything was sort of in that. And I think it's all just. I think it's the whole journey, isn't it, of being part of that whole process. And we all know that co-designs is going to have some rocky times where nobody's here thinking it's all going to be amazing. But I think from us as a committee, I think what we could hopefully recommend this evening is that, and I think it probably goes to your point number 3, it's around how, my understanding from tonight is there's a definite 2-year pause for all the reasons that have been given by the Cabinet member this evening in the looking at Osborne Grove as a nursing home. That's what I've understood, and correct me if I've been mistaken in that. But actually, there seems to be a point now where you need to be met as a co-design group with the officers to understand, to have that wrap up part at the moment, because if there is a pause, then that's a decision made by Cabinet. But obviously you need to be understanding what exactly that means for yourselves as a co-design group. And I think Councillor Nev said about meeting regularly for updates. What exactly does that mean for you, and how does that work for you? And I think that partnership needs to come back up to the fore again, where you're feeling like equal partners in that process. So for myself, that's the main recommendation that I'm looking at this evening, is around at a point quite in the near future, maybe in the next month, that could be done, that there could be a meeting with the relevant people involved. Information around finances, I think, is going to be really helpful to you, just so you understand the financial position. I know, John, sorry, you haven't got much time this evening, but if you could sort of make sure that information is available to the co-design group, then that'd be incredibly helpful. And then you understand where you fit in with this whole process, and maybe rework out your relationship, how this co-design process is going to work going forward, because obviously it's both of you. You know, it's officers and yourselves in equal partnership, having that sort of impact and input into any future processes. So that's the bit that I've taken up as one of the main points. I've got Councillor Brennan, and then I'll look to other members of the committee. Councillor Mason.
Hello. Well, I actually, Councillor Connor pretty well covered what I wanted to say, but I would like to go a little tiny bit further. That I would really like the steering group to be fully involved in, you know what you mean, you're having this pause, and in this pause you'll be working out what you want to do. I think that the amount of effort they've put in, they should actually be involved in that bit, in all of the thinking about what you're going to do, all the way. They have put in 5 years of their time, and I think it would be right that they're involved, properly involved, when you're thinking about it, not just given a wrap up and then we go away and think about it and come back to them saying we're thinking this. I think they should be properly involved all the way, which would probably mean a bit more than updates. It would be more like discussions, you know, we're thinking of this, and have you got ideas? Still co-production, really. You know, even if you're co-producing something else. I think that's we owe it to them to do that, and that is what I would like us to recommend.
Thank you. I think that fitted into the meeting regularly and you're right, I use the word updates, but I think obviously it needs to be a much more equal part of that process. So I've got Councillor Mason, who'd obviously like to.
Yeah, thank you very much. And I think it is the nub of it is co-production, and whether that is a strategy and a philosophy, if you like, that is going to be continued. And I think it would be fair to the group to make it very clear from the Cabinet that whether they are still going to continue with the strategy of co-production, and if so, that it's very clear that that includes both the ups and downs. Because I imagine, I mean, everybody here seems immensely skilled and sensible, and I would imagine that you would have understood that financial difficulties are in place, and you might well have agreed that there isn't a way forward, but you didn't have that opportunity, and now you're having to come here and we've got a clash. So I think when we're working together, we try to avoid clashes and try to make sure that we move forward as amiably as we can, particularly when we're trying to do something positive and good. So I would like there to be some kind of content and statement about whether there is a continued strategy around co-production, whether that is going to take place with Osborne Grove people, and how we rebuild that trust. And that's about, to me, that's about transparency and open debate and discussion. The only other thing I'd say is that if that's going to happen, then number 2 is essential, because you can't really do anything without the finances. So I'd support that as well. Thank you.
Okay, so as a committee, we agreed with the recommendations that were put forward this evening. I'm just checking, there's no one I'm missing on the no. Okay, so and I think where this goes, I think that's an important point as well. So once you've had your meeting around co-design and where you're going with this project, I think it'd be really useful for the committee to understand, because if there's going to be this 2-year pause, which we've heard very clearly from the Cabinet member this evening, it's really, it'd be very helpful for us as a committee to get feedback from yourselves as to how this process is happening as in the next month when you have this meeting and you've understood where you are in terms of finances, in terms of how your relationship is going to happen going forward, in terms of the co-design process, that it comes back to us so that we can understand where it sits. And then obviously as you have the meetings going forward, hopefully that structure will be incredibly clear on both sides, including the financial information. So thank you very much for coming along this evening. It was really appreciated. I know that quite a few of you have made quite an effort to come here this evening, so thank you very much. I am going to have to move us on, sorry, Councillor Brennan, because we do need to move on to the next point. Otherwise, we could talk about this all evening. But thank you very much. We've now got the Maternity Services and Start Well programme on pages 15 to 52. So we're looking at this. We're also going to be looking at the maternity services at the North Mid that have recently had a CQC inspection, which was rated inadequate. So as this Start Well programme is around maternity services, and as specifically it is going to be looking at, for us in Haringey, the North Mid and the Whittington, are very important. We've got people on the call this evening. So we've got Anna Stewart from the Start Well programme coming to speak to us. We've got Vicky Jones, who's the Medical Director at the North Mid, and we've got Claire Dollery, who's the Medical Director at the Whittington. So Anna, apologies because we have run over a little bit. I know you've got a lot to tell us, but we do take it that we have read your slides and the presentation. So what I'll ask from you this evening is if there's anything specific you want to bring up as part of this, obviously a little introduction, but then if there's anything you want this committee to be particularly focused in on, because we obviously do want to have time to talk about the maternity services at the Whittington and the North Mid specifically as well. So over to yourself. Thank you.
Thanks, Chair. I think what we thought we'd do is I'll just do a very quick overview of the Start Well proposals. I'm joined in person by Vicky Jones, as you've said, who's the Medical Director from the North Mid, and on screen by Claire Dollery, who's the Medical Director at the Whittington and the Acting Deputy CEO. They've both been very involved in Start Well as the kind of executive leads for their respective organisations. I don't know if you then want them to say something separately, or if we just turn to a kind of more general discussion might be the best way to do that. So there's quite a long pack in your papers, which, as Councillor Connor has already said, we're going to take as read. The Start Well proposals have been a kind of long-term piece of change work that have been contributed to extensively across the North Central London integrated care system, involving social care representatives as well. So Anne Graham from Haringey has sat on our programme board as one of the kind of DCS representatives and been really actively involved in the options appraisal as well. We're kind of reaching a kind of culmination point of this kind of phase of work, and have published already a kind of extensive case for change, and I'm very happy to talk to that if members have questions about that. So in terms of the kind of areas for public consultation, we are consulting on 3 specific sets of service changes, and very happy to talk to any of those that members are interested in. So the first is quite a large scale change around a reduction in the number of maternity and neonatal units in North Central London from the 5 that we currently have to 4. So currently we have maternity and neonatal units at UCLH, the Whittington, the Royal Free, Barnet Hospital and the North Mid. We are proposing 2 different options for consultation, both of which involve the closure of one of those units. The first option, which we've called option A, is that services close on the Royal Free Hampstead site, but remain on the Whittington Hospital site. And the second option, option B, is that services close on the Whittington Hospital site and remain on the Royal Free Hospital site. In both options, services continue at UCLH, the North Mid and Barnet Hospital. We have said, and it's set out in your papers, that we have a preference on the balance of the evidence that we've looked at through the options appraisal for the option where the Royal Free Hospital closes and services remain on the Whittington Hospital site. And that's for a variety of reasons, some of that due to the kind of complexity of moving staff between different services, and some of those about the kind of modelled outflows to other areas and how easy it would be for them to accommodate that. In the papers we've set out from a Haringey perspective the option of the impact of both options in our modelling on Haringey, and you'll see that there's a much more significant impact in terms of the option where the Whittington is modelled to close than the option with the Royal Free is modelled to close, and I think you'd probably expect that given the kind of geography and the flows in this area. So that is the kind of first area that we're consulting on. Very happy to talk about the kind of pros and cons of both options, the work that we've done, the rationale for the change. I think something that it's very important just to kind of stay up front and kind of be really clear about is that this is a set of proposals that are driven through the case for improving services and meeting best practice standards against a backdrop of a declining birth rate and increasing complexity of both women giving birth and babies who need care. They are not, absolutely not, about taking money out of services. We know that the workforce that we have, particularly midwives and neonatal nurses and obstetricians, are some of the most precious workforce that we have. We're looking at a context where we have vacancies in those areas, and we would be looking, in the event that we did close any unit, to redeploy those staff into other units. In both of the options, either the option where the Whittington Hospital closes or the Royal Free Hospital closes, we have worked really hard with system partners to earmark around £40 million of capital money to invest in the services that we have across the sites that remain. So I just wanted to kind of be really clear about that in terms of the rationale. We're not looking at any changes happening immediately. There would be quite a long lead-in time in terms of reporting on the consultation, making a final decision, and then indeed a lead-in time for any changes to happen. So for women and people who want to give birth now, it's business as usual and all our services remain open. The second area that we're looking to change, and I will cover these in slightly less detail, Councillor Connor, because they may be of less interest to this committee, is we have a standalone midwifery-led unit on the Edgware Community Hospital site. That's a community hospital site without all of the infrastructure of an acute hospital around it. It has a very, very low number of births. So out of the kind of 20,000 births in North Central London a year, in the last financial year there were 34 in the birthing suites at Edgware, and it's been declining year on year. We know that Edgware is a really deprived area, and at the birth centre on the Edgware Community Hospital site there is a really bustling, very busy, well-attended antenatal, postnatal care. We would be looking to expand that provision. We're not looking to take that away. So it's the birthing suites that we're talking about in terms of the consultation. The third area that we're looking to change, and in fact, Vicky, I know, is by background a paediatrician and would be able to talk about some of this, is some slightly narrower in scope changes around paediatric surgery. We are not, just to be really clear, looking at any changes to paediatric emergency departments, but we are looking at changing the pathway once a child is arrives at an emergency department for very young children who may need a specialist surgical assessment or surgery for, say, appendicitis. So for the under 3s and the under 5s for a couple of specialties. And we're looking at consolidating some of that care at Great Ormond Street for emergencies and some inpatient stay for about 300 children, and setting up a paediatric assessment surgical assessment unit to assess those children and to move them through to that specialist opinion much quicker. And we're looking at consolidating, again, a very small number, around 300 day case surgeries at UCLH, predominantly for ENT and dentistry, again, because of the kind of specialist anaesthetic support that's available on that site. Consultation is continuing to run until the 17th of March. We are working and very, very hard right up to that deadline. We've done a lot of events in Haringey already. We are very keen to hear from VCS organisations and community sector voices. We have mailed lots of them as part of the consultation, and I'm very happy to talk about the work that we've done in Haringey and the approaches that we've taken. If there are additional groups that you think it would be helpful for us to talk to, please do tell us. We're doing drop-ins at all of the hospitals in the patch, so the North Mid and the Whittington, and indeed a lot of staff consultation as part of that. So I've already been to like 2 or 3 staff consultation events today at various trusts. So I'm going to pause there unless Vicky or Claire want to comment, and then between the 3 of us, we're very happy to take any questions.
Thank you. Unless you've got anything Kay, so we'll go straight to questions. I think there's going to be quite a number of questions. I'm going to take the advantage of being the chair and actually kick off on this one, and then I'll go to Councillor Haran and then Councillor Brennan, whose hand I saw up. So my concern around this process is that currently the Whittington requires improvement in maternity, and the North Mid CQC is rated as inadequate. So it's not so much around the your option A and option B, which I know is what you've come to speak to us tonight about as to which of those. But I think as councillors looking at the provision of our residents, I think the sort of worry that we have is that what services do our residents currently enjoy and would enjoy after this has been completed. Now, you did mention some money that was going to be coming in to other hospitals once the decision has been finalised as to which hospital was going to option A or option B. But in particular, the North Mid, I mean, I read the CQC report and there's a huge catalogue of concerns. I mean, page 27, 28, I think sums it up. But the ones that I was really concerned around was about staffing, unsafe staffing. That's the point where you're starting to get really worried. Your reports in here saying the staff told us that due to a change in processes, agency shifts were not being filled frequently. We've seen triangulated that there'll be multiple unstaffed midwifery shifts, so that's really concerning. Staff did not always keep detailed records of women's care and treatment. Records were not always kept up to date. And in regard to incidents, the service did not always manage safety incidents well. Managers did not always investigate incidents. Lessons learned were not always implemented to improve services. That is a red flag for me when there's a recognition that things have gone wrong, but there's no understanding of how that's going to improve. And then it also said that we saw on page 17, we saw serious incident reviews that showed a lack of evidence of duty of candour when the perinatal mortality review had been carried out. This was the case where services identified care may have caused harm, such as stillbirths, neonatal deaths, or brain injury to babies. This is absolutely at the sort of the hard end of the CQC inspection. And I've actually put those in red on the notes that I made today that I picked out, having read the whole report. So I think for myself, irrespective of the start well process, it's confidence within how we have confidence that our residents who are going to the maternity services at the North Mid are receiving the sort of care that we would want them to get, and obviously you would want them to receive. And I think it's really helpful if you can evidence for us today ways in which the concerns that have been addressed in the CQC report have been taken on board and have changed. Because during this report, they say, well, we brought this up in 2021 and it's still going on. So it's that process whereby things have been highlighted, but nothing has changed, and in fact, maybe got worse. So I just really would like to hear from yourself, Vicky. I know, you're in the firing line tonight, but I'm sorry, but you're the one sitting here. But it'd be really helpful for us to understand how this is being addressed. Thank you.
Firstly, there's no need to apologise. That's my role, and I definitely would like to acknowledge that the report highlighted failings that we would be rectifying very quickly. I think the first thing to say is the visit was in May of last year, and since that visit we've had a 5-day visit from NHS England, who we invited in to inspect our services as well, to provide further insights, and they were able to identify the progress that we've made already by the end of spring, and we're continuing to work on that. I think staffing is clearly a big issue that was highlighted in the report, and since then we've now 20 new midwives have started, which has made a substantial difference to staffing levels across the department. And I think having those staff in place has enabled us to focus more on training and making sure that all of our staff have the appropriate level of training for everything that we're asking them to do, and around learning, giving that bandwidth so that we can focus on sharing the lessons when things have gone wrong and making sure those lessons are embedded. When you're running on a very scarce staffing model, it's very difficult to do those extra bits, and now that we have those staff in place, that is definitely improving. I think another area that was highlighted in the report was around culture as well, and there was pockets of poor culture identified, and there's been a great deal of focus on those individuals where we've had highlights of particular staff members and formal proceedings there. But the wider piece around making sure that the culture is correct and that we're supporting women and families appropriately, we're focusing on through a specific piece of work with organisational development, bringing in some external support around that as well. The action plan that relates to this is being followed up to board level and being monitored on a monthly basis, so that we're getting that rigour to demonstrate that we are making progress and that the board have sight of that progress on a monthly basis.
Okay, so I'm understanding from what I've read out this evening, are you telling us here this evening that actually what's been read out isn't actually happening any longer, and that actually things are improving and there aren't these concerns that are currently on the maternity unit?
Yes, and we're demonstrating that through audit data. So I think one of the other areas that's highlighted in the report is around triage. I think this is a topic that's come up in a lot of inspections recently in maternity units. Maternity triage functions a bit like an emergency department for pregnant women and people, and having robust processes about assessment of those women, oversight of those women, and timeframes for when they'll be seen, and that is being regularly audited and demonstrating compliance with the standards.
Okay, thank you very much. I'll take Councillor Haran, and then I've got, is it Councillor Brennan? Thanks.
Councillor, did you want Claire to comment on that?
Yes. Apologies, Claire.
Apologies, I couldn't quite hear the question.
So the question is, because of the services that Haringey residents will be using, so the Whittington maternity services is rated and requires improvement at the moment. So it's really about giving us confidence that with the CQC rating for the maternity services, that the maternity services are going to be good for our residents to be able to have confidence in. Thank you.
Thank you. So perhaps the easiest way of summarising that is to say that there were 3 must-do areas for improvement in our CQC report, and that was around training modules for medical staff, maternity theatre and support workers getting additional safeguarding training. And I can absolutely assure you that both of those in place, they have been reported nationally through some of the maternity incentive scheme, and they've been checked within the NCL groups that assess maternity. And the other was using a systematic approach for risk assessing women attending for triage, and we have implemented a systematic approach. It's a traffic light system, and we will be moving on to what's called the BSOTS national system shortly. So all of those things have been done. I would also say that we did get a good rating for the leadership of the unit, and particularly we've had highlighted the good team working between obstetricians and midwives. They have a co-mentoring programme, so when you start in the unit, if you're a doctor doing obstetrics, you are mentored by a midwife, and the same is true if you're starting as a midwife, you're mentored by a doctor, which I think is important. Donna Ockenden has cited the Ockenden cafes, which is the way our team have learnt about the Ockenden standards and implemented them, and she's come to visit them and highlight them as an area of excellence. And also Ruth May a couple of weeks ago came to sit in on our female genital mutilation clinic run by Huda Mohammed, who's one of our midwives who got a CBE for her work. So I think there are an awful lot of good things. It's always disappointing to get a rating of requires improvement, but it was some time ago, and it's been an absolute focus of the team, trust in the board ever since.
Okay, thank you very much, Claire, for that. I'm going to move on to my other colleagues now for their questions. Thank you.
Thank you very much. I think before I start, maybe worth me just declaring I am a consultant radiologist, and I also am a deputy medical director. So I have some sympathy about the CQC ratings, because I think the vast majority of maternity units in this country are either in the category of required improvement or inadequate. But in saying that, I mean, I did read the report for North Mid and as well as Whittington. I think the Whittington was the earlier one in the year, but both were done in the same year, actually. And I think for me, just as a counsellor and with regards to the residents and how they're serviced here, what we're saying essentially is that the women coming to the majority of hospitals in this borough are either going to an inadequate or required improvement maternity service that you could say is very poor service for our residents. And look, I think you answered a lot of the questions, but I think I need a little bit more assurance. I know a lot of the work that you're doing now is to try and address some of these concerns, but actually what I'd like to know is that what is the plan to move from inadequate in the North Mid and required improvement at the Whittington to actually good? How are you going to address some of the real concerns which I read, which is staffing? How are you going to address that? And what have you done to address that? Secondly, culture. I want to know a little bit more, because I think fundamentally that's the most important aspect of the maternity services and why they fail. It's the culture and the relationship between the midwives and the medical staff often. Thirdly, the infrastructure. Do you have adequate infrastructure to deliver the type of services that you want to do? If not, what are you putting in place? And I think finally, did you accept wholly the CQC rating, or did you push back on some of those? And if you did, I would like to know what it is that you pushed back. And my final question is with regards to, I think there's a specific issue with regards to water births at the North Mid. And is that facility still are you still doing water births at the North Mid? Because I think on that CQC, there was a very specific concern raised with regards to water birth. Thank you. I'm sorry, there's so many questions there, but there's a lot to ask, actually.
Thank you. So if we start with staffing, so I've mentioned the increase in midwife numbers, which has gone a long way to manage the shortages that were there. Obstetric staffing is very good, actually. We have a fully complement of consultants. And I think similar to the Whittington, we've had positive feedback about the work between midwives and obstetricians, and actually a good culture of working together. I know that's been highlighted in other units as a concern, but that's not been a concern for us. The comments made around culture were within midwifery rather than between obstetricians and obstetrics. On your point about infrastructure, again, we're very lucky. We have a fantastic unit in terms of the physical build of it. Very large rooms, which are really state-of-the-art for our families. There was an issue, as you say, about water births and specifically around training to ensure that everybody could undertake an evacuation of the water birth area if required. And now all staff have completed that training that undertake water births. So I can confirm that. You said staffing, I've said staffing, infrastructure, water births. I've missed one. What was the second point you?
There was, yes, culture and training. There was an issue around mandatory statutory training and generalized training in particular, which was very low, and has that changed?
It has. So across the organisation, mandatory training is above the standard. The only area where we still have some training to complete is around some of our life support training, where we're very nearly at our target of 90%, but just due to sheer volume of people that need to be trained and the some of the impact actually of industrial action on our resuscitation team who've been diverted to doing that, but that should be complete within the next few weeks. But mandatory training figures are significantly higher than they were when the inspection was undertaken.
And did you wholly accept the CQC assessment of the unit, or did you push back on some issues? Because often this is what we do, right? I would like to know what it is that you pushed back on.
Okay, so we undertook the usual factual accuracy exercise, and where there was areas where we felt that there had been inaccuracies, particularly around data, then obviously we provided corrected data as part of the factual accuracy check.
Okay, thank you. Was that a question to the Whittington as well, or just?
Yes, please, because I think both units were assessed in the same year. Actually, it was in 20. If I remember correctly, the Whittington was also in 23. I think it was the Royal Free that was earlier. Is that right? 21, I believe, the Royal Free.
So I can comment on Whittington. We were assessed in January 2023. In advance of the CQC inspection as part of the Ockenden process, we had agreed to fund 6 additional consultants. This is just on a staffing basis. We are still investing in midwifery. 5 of those new consultants are in post with locums in the other areas. So staffing has been a focus, but has been successfully addressed. With respect to culture, you probably have seen that the CQC report itself says that staff felt respected, supported and valued. They were focused on the needs of women and birthing people receiving care. The service promoted equality and diversity in daily work and provided opportunities for career development. The service had an open culture where women and birthing people, their families and staff could raise concerns without fear. We also had specific positive commentary around how we work with Maternity Voices partners, which is really, really important to us. So I think that probably answers most of your points. With respect to pushing back, we've been through a similar factual accuracy process with the CQC. So as you say, that's pretty standard. And with respect to mandatory training, the staff groups that were highlighted are all now compliant.
Just if it's worth saying, so clearly the CQC is an ongoing live process in the here and now, and it's, as both Vicky and Claire have talked about, Individual trusts are working very, very hard to kind of look at the outcomes from those and to take action where it's needed and to take that really seriously. I did think it was probably worth saying a couple of things, which is we have a really, really active local maternity and neonatal system, which all of the providers in the patch in NCL are very much a part of, which is designed around sharing good practice and fostering a kind of learning environment where units are working together to share good practice. I think there is also a very active feedback loop between the work that we've done around the Start Well consultation and the work that's happening now. So through the consultation process and leading up to the consultation, we've done an unprecedented amount of engagement with hard to reach groups, groups as part of the kind of integrated impact assessment. We heard some really, really difficult things from service users about their experience of using local services. And we've used that data and in fact all the kind of analytical work that we've done about who's using our services and the kind of the way that that's working to actively feed the work of the LMNS and the improvement programme that they're looking at. So it's actively driven us to apply for, and we're really unusual as a system in applying for some work that's going on through the Race and Health Observatory around anti-racism work within maternity services, and as a sector, as a group of providers, we're one of the kind of 9 or 10 sort of groups within the country that have been prioritised for that work, which is about actively doing a kind of plan, do, study, act kind of learning improvement programme QI approach around areas. So I just wanted to make that kind of connection between the kind of the longer term work that we're doing and the work that's happening now. I think the other thing to say is that we strongly believe that by having a smaller number of units, that we will be able to better use our staffing resources and to meet the kind of quality standards, the best practice standards that we know we need to meet, because we will have some of those economies of scale in terms of some of the rightly new kind of much more exacting standards around Ockenden and some of the other standards. So although it's in the future, we think it's a really important part of that active improvement programme and the process then of investing in our estate as part of that.
So I've got Councillor Brennan and Councillor Mason and then Councillor O'Donovan. Thank you.
My question leads directly on. My question leads directly on from what you were saying, so I'm interested in the future. So I had already understood that the plan is to reduce the number of maternity services, and then I understood that you were going to sort of totally modernise the Whittington, so it's going to become sort of state of the art. Is that sort of a lot of modernising is going to go on with the Whittington maternity unit? And then I wanted to know, is some of the money going to be fed also to the others, such as the North Mid as well? Because I knew that you were going to update facilities at the Whittington, but you're also going to put some more money into the North Mid.
As I said, there's about £40 million of capital that have been earmarked in either scheme. So in option A, the Whittington remains and the Royal Free Hospital closes, and the kind of vast majority of that money would be spent on the Whittington in terms of upgrading its Victorian estate, which is, you know, very, very significantly in need of some modernisation. There would be money spent on other hospitals, and it's a slightly different composition in each of the combinations of hospitals in each of the options. For the North Middlesex, as Vicky has described, the actual infrastructure is really lovely, and what we have modelled in both of them is that there are both neonatal cots and birthing suites at the North Mid that are not open at the moment because of staffing constraints. And so in the options where the Whittington closes in particular, where we would see a greater flow of cases to the North Mid, I think we do need to invest some capital money, but in the option where the Royal Free is modelled to close, we can accommodate that additional capacity within the existing infrastructure, which is, as Vicky has said, very nice. In both options, we would need to expand the facilities at Barnet Hospital to accommodate some flows there. So it's a slightly different combination of how the money is spent in each of the options, but in both a significant degree of investment in either the Royal Free Hospital or the Whittington Hospital, in either of those options, and then in some of the other hospitals. And there is money that has been earmarked as part of kind of business as usual kind of work to increase the number of neonatal intensive care cots at UCLH, which is another significant kind of pinch point that we've identified as part of the kind of start well case for change.
Thank you. Councillor Mason.
Could I just come in on one point, in that actually at the moment we haven't got beds closed because of any staffing constraints. It's because we don't need them open because there's been a fall in the birth rate. And when the unit was set up, it was built up future-proofed to have additional rooms for expansion. So we will be able to deal with more babies, but it's not that we've got beds closed at the moment for any concerns with staffing, just to make that clear.
Councillor Mason.
Thank you, and thanks a lot for all the detail you've given us. It's really helpful, and for detail about the learning improvement programme that you're undertaking. From the point of view of me sitting here as a local councillor, I'm obviously concerned to represent the residents in my area and their experiences of both hospitals in terms of maternity, and they clearly haven't got a good reputation. Not because I think lots of people have had bad things happening to them, but when you get a report, which a CQC report, then it has a reputational devaluing of what's happened, if you like. It's much harder to rescue something when one thing has gone badly wrong than if 99% of stuff has gone a tiny bit wrong. So I would like to know, one, how whether complaints from patients have gone down, or whether and how you are addressing them. I'm assuming, I don't need to know the details, I'm assuming you're taking complaints and that you feed back and you've got a lively discussion going about complaints, but also about whistleblowing and how you're dealing with those and whether those have decreased or increased. And then the second thing I wanted to ask you about was the whole issue of communication, because I think that's quite often where there is failure. You know, you can get these great individuals, but how people are communicating with each other. And actually, my daughter had a baby at one of these hospitals, I won't name the name, and the communication between the consultant and the midwife on the ward was terrible. And she nearly died, and the baby nearly died. They had to rush her in really quickly, and it was because the consultant had said, she needs to deliver immediately, you need to get her in to deliver, and the midwife didn't agree. And so everything just stopped for about 6 hours with us going crazy. I'm only saying that because that's not dissimilar from the communication issues that I've heard from one or two other people. So that's really what I want to know, that you're addressing communication, addressing who is responsible, who takes orders from who, and also the issue about complaints. So thank you.
Thank you. Me to go first. So yeah, so obviously complaints are rich sorts of information for us, and acting on them is really important. I think the most useful metrics I've seen in recent weeks has been our maternity experience survey from the CQC, as a broad range of feedback. I think the good thing about this year's survey is many more women completed it than in previous years, and I think it's 36 questions. For 34 of them, we were average or above average, or well above average. It was just 2 areas where we scored below average, and actually some really, really improved scores from the previous year, particularly around communication, actually, which was pleasing to see, and feeling that you were being told the same thing by different professionals, because I think that is often an area of distress if you feel like you're getting those mixed messages as well. So really pleased to see that, and feeling that care was being explained well, and knowing what the next steps were key positives as well. One of the other ones where we score the most highly is having support from your partner on the ward, and being able to have your partner stay overnight with you on the ward as well, which many families value. value. So I'm taking that as a positive sign that we are delivering the care that our families want, always more to do. On the whistleblowing point, so we have had, as the executive team, we've had letters from staff, but they have signed those letters and they've shared their names, which I think is a good sign that they feel that they can highlight their concerns directly and they're happy to be named and they don't feel it's going to be to their detriment. So I guess that is a form of whistleblowing, but they feel able to share those concerns. And they were particularly a few months ago around staffing, and they were now getting feedback that they recognise with the additional 20 midwives, they're really feeling the impact of that. And then I think, yeah, communication is key. I think, again, from the report, the way that there's positive comments about the way that obstetricians and midwives do work together, our regular huddles, safety huddles that are held throughout the day, so that if there is any disagreements between team members, they can have those discussions face to face, is really important as well. But there's always room for improvement on those things.
Great, thanks a lot for that. And it's really encouraging to hear you talking about things like complaints as being central to how you improve services. Just one quick tiny thing is that I've worked for a long time in domestic abuse and sexual abuse services, and I just wondered, it's just a nudge really to remember those people when you're doing your consultation, because often they're people who've been victims of a lot of trauma. So, you know, it's good to hear their view about the maternity services. Thank you.
Okay, thank you. Claire, I know you had your hand up to come back as well, so over to you. Thank you.
Yes, thank you. So as Acting Deputy Chief Executive, I sign off all our complaints, and I can tell you that we definitely think really deeply about them and how we can use them to be better than we are today. We've obviously similarly had the results of the maternity survey, and areas that were improved this year, including people feeling they were given appropriate advice and support at the start of labour, information about risks during labour, and feeling that their concerns were taken seriously. Now, I'm not going to say that that means we get it right 100% of the time, so we still need to be listening and learning. I do think it's important that the CQC said the service was well led and that team working was good, and most importantly that we work closely with Maternity Voices partnerships, who are the long-term representatives of every woman or person who comes to give birth with us, and they have the long-term memory and the discussion with us to raise issues so that we can change. I think I mentioned the Ockenden cafes that we have as multidisciplinary training to embed the Ockenden standards, so that we don't just talk about them and tick a box to get there, but we're actually working together to say, how can we do these in the right way? And in common with other maternity units, we also are carrying out what's called prompt training, which is training for maternal and neonatal emergencies, which not only do people have to comply with, but they have to come to the training in professional groups, so that you have midwives, obstetricians of different seniorities, and anaesthetists and paediatricians all coming to train together, so that if you are going to deal with a situation together in real life, you will have rehearsed it in a simulation setting, which reflects the way work really happens when you're on the labour ward or the neonatal unit. Our neonatal unit also leads on a number of different training programmes. It's probably worth saying that one of the important demarcators in the Start Well process is that we have a level 2 neonatal unit. It's probably easy to explain that expanding an existing level 2 neonatal unit is easier than turning a small level 1 neonatal unit, which only looks after babies born after 34 weeks, who are very relatively straightforward. So expanding that to be a level 2 unit, which deals with much more complex babies, is difficult. And as a result of that, we are an accredited training centre for obstetric registrars who are middle grade doctors who are the consultants of the future. But unfortunately, the Royal Free lost its accreditation some years ago because there wasn't enough clinical experience for the doctors with the type of babies and the number of babies that are looked after at the Royal Free. So that's also been an important aspect of Startwell in terms of how we recruit, retain and train the different, in this case, doctors, but also midwives, obviously, for the future.
I was just going to
just
say,
very briefly, thank you.
Yeah, so I think there's a lot going on now about listening and thinking about. I just wanted to acknowledge, I think, Councillor Mason's point, which is through all of the kind of engagement and the conversations we're having around Startwell, communication in all of its different facets is the thing that comes up the most with patient and resident groups, and that's slightly different for every single group. So we've done quite extensive engagement with the LGBTQ+ community about how it feels for them and some very specific issues around them, around different ethnicities and also people with different kind of long-term conditions and kind of disabilities. And all of the nuances of the communication for each of them is really slightly different, but it does boil down to communication and the interaction between the pregnant woman and person and staff members and between staff members about their care. And so it is a huge focus and one we need to keep kind of coming back to, I think, in terms of the feedback that we've heard. And it is driving, that feedback is driving our thinking about the mitigations that we'll need to put in place if we do make some changes as a result of Startwell, and also the groups that we are targeting for really specific kind of engagement during the kind of consultation process.
Okay, thank you. We're coming to the end of this part of the, but I've got Councillor Donovan who has had his hand up, and then I've got Councillor Poku. So again, just be aware, again, we are slightly overrunning, so if we could just have succinct, I know you really want to give us absolutely all the information, and we do appreciate that, but if you could just sort of encapsulate it, that would be really helpful, so to make sure we've got everyone's questions. So Councillor Donovan and then Councillor Poku.
Okay, thank you. The questions were in relation to your pie charts on page 16 and 18 of your presentation. On page 16, you talk at the top about 98% of activity for Haringey would remain at the same hospital. A little bit further down, 2 lines further down, you mention Enfield. I think, is that a mistake? Should that be Haringey as well? 98% of deliveries for individuals. That's in option A if the Royal Free is closed. Over the page, option B, 56% of activity in Haringey would remain at the same hospital, which means that there would be more, obviously, more movement. In terms of your projected deliveries, option A, you've 1,500. That's projected deliveries for Haringey Borough residents. Obviously, there'll be Enfield residents as well. But in option B, it goes up to 2,100, which is an increase of 40%. Now, I know you said earlier and related there will be funding available, but is there physical capacity in the North Middlesex for 40% more deliveries? And not only that, will there be staff available after Brexit and associated other policies by the government? Will there be enough trained staff or staff training for that extra capacity, taking into account other things that we've said also about the North Middlesex? And also on page 34, your consultation approach, which I think is very thorough, when you talk about everyone that you'd want to approach, including inclusion, health groups. It's certainly, if we're doing a consultation, those are exactly the sort of people that we would like to reach. But the 17th of March isn't that long away. Are you reaching those people? Are you confident you are reaching those people? And what more can be done? Thank you.
Thank you for the question. So the slides that you're talking about look at the kind of distribution of the kind of births in either of the options where the unit is closed. The Royal Free is a smaller unit, so it's a smaller number of berths that would need to be redistributed. So it has about 2,500 berths a year, and the Whittington has just short of 3,500. You are right, it's a much more significant impact in option B, where the Whittington is modelled to close, and we're looking at around the modelling would show around 44% of deliveries from Haringey would therefore need to move to another unit. We have worked really closely with all of the trusts in the patch, both on the kind of modelling approach and on what would be needed in terms of both kind of delivery capacity and neonatal cots in order to accommodate that. The berths at the Whittington wouldn't all go to the North Mid, they would be distributed across a number of different units is our prediction in terms of where they would go. So some would go to Barnet, some would go to Camden providers, and a few would go over the border into Hackney. But we are confident that we have done the work with the providers, and I was describing that the North Middlesex has capacity that isn't open at the moment, both in the neonatal unit and in the delivery suites. In the option where the Whittington is modelled to close, we would need to do some capital work to expand it even further, but we have worked really closely with colleagues at the North Middlesex to work out what would be needed. In terms of the consultation, we have been working really hard since the 11th of December when it launched. We've done well over 100 kind of community meetings and staff meetings across kind of the 5 NCL boroughs, and we're also including Brent and Harrow because they are impacted as part of the potential changes to the Royal Free, and we need to include them within the consultation. We're using a really wide variety of kind of techniques, so we're going to a lot of voluntary and community sector organisations. We've commissioned some very specific focus groups through a specialist partner who is working with asylum seekers, the homeless, some other sort of really particular communities, commissioning some specialist focus groups in the areas that we've highlighted through the kind of integrated impact assessment as being kind of geographically impacted in terms of either of the options. And there were 2 particular sets of geography that were highlighted in both of the options. So for the option where the Royal Free is modelled to close, Willesden and Harlesden were modelled as being particularly impacted, and in the option where the Whittington is modelled to close, Holloway and Finsbury Park were modelled as areas that we wanted to focus on. We've done in the process of doing a direct mailing to a significant sample of the residents in both of those areas to make sure that we've kind of really fully captured views. And we also then have the kind of social media that we're doing and the general kind of survey that people can respond to. And there are posters all over all of the trusts in terms of kind of links to those. If there are particular groups, and I know that you as community leaders will have those, if there are particular groups that you think we should think about coming to, then please do tell us, and we will, it's really not too late to kind of focus on those. But we have already been to a number of drop-in and other groups with groups within Haringey.
Yeah, thank you. My one is more just of interest of how you've grouped the ethnicities. So on page 34 of the pack, where you're looking at the impacted group, and on page 48 of the pack, where you're looking at the constitutional approach, you mentioned Black African, and you say including Somali. So why are you including Somali? Are they not Africans? It's just an interest. Why is it like that you group them that way?
So we've worked with a specialist partner to do the modelling for the integrated impact assessment. I would need to ask them about the kind of framing and the terminology that they've used, if that seems a bit peculiar to you. The way that we've done the modelling, and it might be something Will kind of would comment on, but we've looked at groups that the kind of travel analysis and the kind of catchment areas for the options and where people are living, and then we've overlaid on top of that groups which we know have poorer outcomes in terms of maternal health, and particularly those areas are the ones that we've then are focusing on in terms of looking to kind of focus on them in terms of the consultation.
I've got Councillor Peacock and then I've got Councillor Singharan, and then we're going to be wrapping up on the questions because we really do need to move on to the next section. So thank you very much. But Councillor Peacock.
I just wanted to comment on the Somali because when I was a councillor in Northumberland Park, we had a really big problem with Somali mums not presenting themselves to the hospital for prenatal treatment and just arriving at the hospital as they're about to give birth. So it was very difficult, and that's why I think they should be concentrating on the Somali mums to make sure that they actually do use the facilities that are available to them. So that may be why they're listed here.
Confirm, I think we've done 2 or 3 focus groups with Somali women who have experience of using local services within Haringey. So we have particularly, sought to kind of focus on them through the course of the consultation.
Thanks. I'm just mindful we spent all the time talking about the maternity services and very little on the pediatric. So I just want to try and understand. Look, I clearly understand now how we, designate a pediatric high risk under the 3 years of age. I just want to understand what impact that will have on the residents in our borough, because they have to travel further, the impact on maybe certain demographics, the cost implications. Has that all been factored in the moving of these services?
Both shot. So we've covered it in the integrated impact assessment, and I think particularly we were keen to speak to residents of Tottenham as part of kind of some of the work on surgery. It does have a cost implication, I think, in that it's probably a single admission for some of these conditions, but there is a journey to do it. I think to be really, really explicit and clear with members that are here, these are children that are being admitted quite far afield already. For very young children, the anaesthetic skills that are needed to intubate them and to do surgery are more complicated, and there are very few local units that will do those young babies. So a lot of the babies and young children that we're talking about are already going to Great Ormond Street. If they are not going to Great Ormond Street, they are probably going to the Royal London or to Chelsea and Westminster. So there is already a journey time built in. We have been really upfront about the fact that by kind of baking in what this kind of pathway would be, does involve some costs, and we will need to mitigate it. But these are costs that are probably there already. I think for parents, and we heard it really, really clearly from colleagues who work in the emergency departments, that the pathway at the moment does not work very well, either for staff or for parents. And so what we would be doing by creating kind of a paediatric surgical assessment unit and smoothing out that pathway, if we go through with that, is a kind of automatic acceptance at GOSH. At the moment, what we have are staff phoning around to try and find a bed and to get those very young children admitted for that surgical opinion. And that can take a wee while, and it can be really stressful for the staff. It can be, I imagine, incredibly stressful for the parents as well, waiting for that to happen. So this is about making that a better experience for everyone. But we have been very clear that for those single admissions, and these are generally single admissions for a suspected appendicitis or testicular torsion or something like that, that there would be a cost in terms of the travel to and from and visiting.
So I'm just going to pause you there for a moment. I've got Mrs. Lewison, who I know here's for another agenda item, but you've got your hand up. Is that you wanted to come in? And if you do, could you speak to the mic? Sorry, so it can be captured. Sorry. We don't normally call members of the public, but you are here for another item, and you have been waiting.
Oh, you just press it once. You didn't think I was an engineer. Right. I am the parent of a severely disabled child who was failed by maternity services. We actually got failed twice, but only one ended up with a very severe disability. Have you done or have you thought about the genuine cost to parents and families like ours? And how many trips do you imagine we'd make a week or a month? And how many appointments do you imagine we have? Because every day this week, I've had to make a journey relating to my son's disability. There's 3 next week. There's 3 the week after. It's made I've had to delay other things like Andrea Kelly wants to send a social worker around. I've had to put her off for weeks now because we're just not free to do it. But the cost of that is extraordinary. And we're talking about £40 round trips, particularly with the new way roads are laid out. In terms of LTNs, which everybody knows. I'm a cyclist, and I love it. I'm whizzing around 40k on a Saturday. But for my son and his severe disability, the impact is immense. And the cost of us on a family is extraordinary. And I'd like to know what modelling you've done around that. How many trips on average do you think parents of children with severe disabilities make a week, a month, and what the cost of that is and what the additional cost of that is when you move services? And that's my question. Thank you for letting me ask it, Councillor Cohen.
So I don't know if you'd have that exact information at this point, but I think if you could give a sort of an understanding if that's been taken as part of the consultation and you're looking to capture that data.
So I think that there are existing pathways, obviously, for really complex children. It sounds like your son is one of them who have complex needs and need multiple hospital trips and appointments. And that is not the kind of change that we're talking about here. These are we've modelled about 300 patients, and these are predominantly one-off surgeries. I am not for a minute, and I've got a child with quite complex needs myself. I do know that it is very, very expensive, that kind of ongoing kind of trips, but this is not the change that we're talking about here in terms of these multiple appointments.
Yeah, I mean, I think the problem is that everyone looks at their service as a one-off. So school might look at their service as a one-off, and they only see us once every term. And social services might view the same, as adaptions might see views as one, and AIDS might do views as one, and Andrea's team might view us as one, but they all add up.
Completely,
and so it becomes, just extraordinarily, prohibitively expensive that the bulk of your free money, your cash, is being spent on travel and transport and your time. So this week alone, Monday I spent 4 hours either travelling or at an appointment. Yesterday I spent 4 hours, and I was actually in a meeting yesterday for 3.5 hours for continuing care assessment. That's a huge amount of time, as well as the additional time that's now added on because of travel and travel restrictions. And it just needs to be considered, factored in. Does another policy need to change? Do you need to put more money into, London taxi cards to help with the cost, or do you need to increase personal budgets from a social care side to help with that? And employers need to have more flexible policies to allow parents to do that. But I live in Tottenham, and moving a service a little bit further away has huge impacts for those of us who live there.
Okay, so I think what we're hearing is that you are looking at those wider implications, and that's going to be coming out in your report on Startwell. You're going to be capturing that sort of impact on people that are needing to move or to travel further. Is that correct? Thank you for that, and thank you for making that point. So I'm just going to quickly sum up because obviously we do need to move on to the next agenda item. So I am going to sort of take a wild guess here and say that probably definitely as a committee, I think our recommendation would be that we would support option A, which is keeping the Whittington open. And obviously that would, that entails the closure of the Royal Free Maternity Services. If I'm incorrect, please indicate now. Otherwise, I'm going to take that as a understanding. I think, though, that for as a committee and the members have highlighted this evening, we do have real concerns, particularly around the North Mid CQC of inadequate. I know the Whittington have specifically spoken about their areas of concern because obviously their CQC was requiring improvement. So I think as part of this Start Well process, I think it was really helpful to understand once this consultation has taken place, once the decision has been made, which option you're going to go down, that we get feedback around the implications and the finances that are going to be used to support the North Mid and the Whittington in any sort of improvements in their services, and particularly, I think, particularly focusing in, as this report has done, I think it's going to be really helpful for the Scrutiny Committee to understand what do we hear in a year's time or 2 years' time once this process is up and running, because obviously whichever option is chosen, there's going to be a review process to that and an understanding on how that is working and how that's affecting our residents. So I think that'd be really helpful for us to hear back as a committee once that process has taken place. I think the other issues that I just would like to raise from this evening is the unintended consequences of a changing to service. So I know we've spoken before about your consultation, and if there's any areas of concern that have been brought up by residents, I think it'd be really helpful for us as a committee to understand what those are and looking at how those are going to be addressed and whether different information can be provided about different amounts of money to, offset some of costs, etc., travel costs. I think that was really helpful for us to understand. I think that was it around the recommendations that I had from this committee. Are there any further recommendations from members on this? No. Okay, so thank you very much for coming this evening. Really appreciate your time, and sorry it's overrun, but there was quite a lot going on, but thank you very much. Thank you. Okay. We're now going to go straight into agenda item 8, which is aids and adaptations update, which is pages 53 to 106. This is to provide an update on the provisions made out adaptations following the recommendations made by the panel in September 2022, which we've got a link to. And then we've also got a previous update from the panel in March 2023. So within the pack, we've got the slides around what the recommendations were. And I know that there's, within the slides, there's what we asked for and then what the council has done in response to that. So I'm very pleased to welcome Corinne here tonight. You're an interim head of service, is that correct? In integrated care, and I've got John and Tomlinson, head of service, commissioning, brokerage and quality assurance, coming to speak to us. We also would like to welcome Mrs. Levison to the table because she has been part of the process, and she very kindly has been part of the scrutiny process as we've gone through, and it's always really helpful to have members of with, I'd say, lived experience. Sorry, that's a very shorthand way of saying that probably know things better than we do on the committee. So it's very helpful to have Mrs. Levison here. But I will start by asking Corinne and John to introduce the report, and we will obviously be going through, I think it would be helpful as a scrutiny committee if we go through the actions requested by scrutiny, so the slides in particular, so what we asked for and then the update from the council. So we'll just go through each one of those, so you don't need to dwell too long in your opening bit about that. So over to yourself, Corinne, and John. Thank you.
Hi, good evening. So this came out of my understanding, Scrutiny from September 2022, where it was identified that there were some flaws within our adaptation process, particularly about communication and the length of time that it was taking for process to be completed. So one of the actions was around when the initial assessments were being made, and making sure that the family were at the focus of the remain to be part of the assessment around procuring the Aiden adaptations and ensuring that they were fully involved. So where the update with that is, in terms of the adaptation journey, the OTs are keeping residents informed about the process. More contact is being made in terms of updates on where they are in the process. So as a part of that, we have implemented a 4 to 6 week pathway, review pathway, where all people on the waiting list and in progress of their adaptations are being contacted every 4 to 6 weeks with an update of where they are, whether they're on the waiting list, at what stage their case is, and those that are actively allocated to a surveyor are also being kept updated of where they are in the process. So the next one was about an advocate being offered by the council, and this is now being done at the assessment stage, where residents, where needed, are being referred to Voiceability, Disability Action Haringey, Connected Communities and or Power Her.
Karen, I'm just going to stop you there. I think it'd be helpful if we went through each of the slides with the committee. Is that okay? I know you were going to, you looked like you were going to give us everything, which was great, but I think if we just do one slide at a time and get the committee to ask questions on that, but I think that's probably going to be the easiest way for members to sort of go through this process. Is that all right with you? Are you happy if we do that? So we'd look at sort of page 60 and actions requested by Scrutiny. And as you rightly said, that's started with the occupational therapist.
60.
So what was that about page 60?
I had started on page 60 of what I've got as page 60.
Saying stop there, get questions,
Oh,
then go on
sorry.
to the next one.
Sorry. Okay.
No, is that okay?
That's absolutely
sorry.
fine.
Otherwise, we're never going to remember it all. And you know, as it gets later and later, we need to sort of, slow our process down. Perfect. Okay. Thank you. So you've very helpfully started with the actions requested by Scrutiny. And that's on page 60. And the first one was the initial assessment by the occupational therapist. And then you've given the update on what the council is looking to sort of do. So can I just check with yourself that this is actually happening at the moment, is it? And have you got enough OTs and occupational therapists in place for the number of clients you've currently got in this process?
We have recruited an additional OT and OTA within the adaptation service, as well as the OTs that we have. And they are working closely on anyone that's within the adaptation process. And we also have a adaptation delivery manager who's overseeing this and also stepping in to provide support.
Okay, thank you. So I'm just going to ask on this first slide regarding occupational therapists, were there any comments or questions from the committee around, unless it's Councillor Leveson, but Mrs. Leveson, about sort of around the OT specifically? I note that at the very beginning of the report, you did say that there was still a number of people on the waiting list. Is that something that is being held up by this? The occupational therapists, or are there other reasons why there's not, the waiting list hasn't yet been cleared, if that makes sense?
Yeah, so there is, I guess we're still looking at the customer journey and the length of time that takes. At the moment, we are doing a piece of work called The Best Day. So we're looking at 2 cases and going through them in a best day scenario and seeing how long each part of the process takes, where we have the hold-ups, why we have the hold-ups, and then looking at that in terms of making improvements. So that's something that's happening at the moment. We have recently taken on 2 new surveyors, and we have 3 more starting in March, and we are going to be looking at some companies to look at outsourcing some of the backlog work.
Thank you, that's really helpful for that. I've got Councillor Karen.
Thank you. Thank you for this, actually, quite helpful. I don't want this to be about casework, because I don't think it's helpful, but I just want to give an example. What happens to someone who lives here, so lives in the borough, admitted into hospital, and then discharged home to somewhere outside of the borough because their current home is not fit for them to go back to? Because I have one particular case. It's taking much longer than your 4 to 6 weeks. So I just want to know when this process has started, and if it's ongoing, and if so, are you sure it's working to plan? Because it's not for this particular person.
So we do also have a waiting list for our OT assessment. So it's the OT assessment that's done first, and then following that, the recommendations are made, and then it's then passed over to the adaptation team, which consists of our surveyors. So at the moment, we are also looking to outsource some of our OT assessments to get those done quicker. And we have identified a company that will be taking on 100 cases a month. So we'll be moving those along very quickly as well.
Is the plan of the council to house people in the borough, or if they've been sent somewhere else, to say, actually, you're somewhere else, we're not going to bring you back to borough? Is there a concerted effort? Yeah.
Sorry, thank you. If I can come in here. It is not the plan of the council to place people out of borough. I don't know the specifics of the case. I'll be happy to take it offline and to look at it. But the adaptations have a range of complexities. So I don't know about this specific hospital discharge. But the other thing we have to be clear about is we can't keep people in a hospital bed. Obviously, you will understand that.
They're not in a hospital bed.
I thought you said they were discharged out.
Discharged out.
Yeah, because they needed adaptations to their home.
Correct.
Yeah. I think it's better if we take it outside, because I don't want to get into details of specific
that's right.
cases.
I didn't want this to be casework, but I just wanted to make sure that this process is working. And all I'm trying to make is, I don't think this process, as you've put it, is actually working. And I've just given you an example of how it's actually not working.
But I don't think I can answer that without knowing more details of the case. The person may be out of borough temporarily while the adaptation is going on. And I don't know the complexity of that actual adaptation. And I'll be happy to talk to you offline about it, because it's good to know the specifics of the case. Thank you.
Could I just come in, because I think some of what you've asked also strays into the politics. I think it's absolutely not the policy to have someone outside borough. But as you know, if someone's house, in hospital, if they're very keen to get someone out, which they are, and people leave earlier, sooner perhaps than in the past they did, for the reasons that we all know, and then someone's house isn't fit for purpose, we then have to find somewhere. And as you know, since we, for the first time ever in the borough, have people housed in hotels in Ilford, which is absolutely not where we would like to be, and there's a good reason, because we're in a huge housing crisis, it might well mean that the only place we can find to put someone is out of borough. That doesn't mean we've shunted them out of borough, and actually if they've still got a home here, that's not what we're doing. We're presumably trying to, in my experience of cases, and I'll get a lot in my inboxes, some are quite quick and easy and some are much more complex, and then it all depends on whose house it is there a housing association involved, and navigating all that. But I think so appreciate what you're saying, which is in this particular case you think it's taking too long but it's difficult for us to answer the question as to why it might be taking that long in that case. Not saying that there aren't hold-ups at our end, and I think Corinne's highlighted that there's quite a lot at working against us, but I think without working through that case, I'm quite happy to pick it up outside. It'd be useful to know.
Mrs. Leveson?
Yeah, I have to say I don't recognise this as improvement. And I have to say for the two areas that we're involved in, aid and adaptations, we originally gave evidence to Councillor Connor September 2022, just after the Queen had died. We've had a minute's silence, won't forget that. And those cases that we spoke to her about, because they'd been through the LGO, are now back at the LGO. And there's exactly the same problems that had arisen, the same problems that arose that resulted in these recommendations. I wouldn't even say repeated, I'd say they'd worsened. I specifically asked for monthly meetings to be updated. I sent questions, submitted questions prior to the meetings, so I understood the specifics of the works that needed to be undertaken. People in the meeting, that was in November. In December, they weren't able to answer the questions. In January, they weren't able to answer the questions, and the meeting was actually abandoned because there was nobody there to answer the questions. I hadn't had the meeting minutes of the previous meeting at that stage, and I said, I'm not leaving this meeting until they're forwarded to me. Threw my toys a bit, but it seemed reasonable. I was supposed to have a meeting on Monday with an OT. I hoped that she would be able to answer the questions that I'd posed on November the 22nd. You see, I have what you might recognise as a Gantt chart of complaints against Haringey at the back of this diary called Zach, where I keep records of every meeting that I attend on his behalf. And so it was November. Adaptions was 21st of November. I was told that we'd have to move out for two weeks. So on the 20th of December, I tried to find out more about that. Would it be in 2 one-week blocks so that we could organise it around our other responsibilities towards our work and our son's ongoing care needs and his attendance at school and our daughter's attendance at university? And then I was told that it was my fault that there was delay because I'd not got back to them. And then I was told that we'd have to move out for 3 weeks. So with Andrea up there on the telly, we talked about booking a place in August and her funding it, and I booked it on my credit card. But neither of us are still any the wiser as to whether those adaptions are going ahead. We have been supported by Disability Action Haringey, who this week attended a meeting with me yesterday and have been very supportive. But there is, I don't want to speak for Phil, but I think he's as exacerbated as I am about the quality of communication. And they're both, we actually have 6 active complaints with Ombudsman, Parliamentary and Social Care, and 4 with the LGO, 1 with the North Midwife Council, West Midwifery Council. So they've been escalated outside of normal levels, but they've all got, they've all passed that initial assessment and are now active investigations. As on a side note, I've got 2 with North Mid because I went to GP, I said there's something not right with his head and his elbow in November. And then we had an appointment in December. I copied counsellor just never in because I wasn't happy. And yet last week he had an x-ray in January, but they didn't notice that his elbow is broken or isn't aligned properly. So I'm in Paris last week and they're like, can you come in tomorrow? And I'm like, I'm in Paris. Can you come in on Friday? I'm in Paris. And I'm going in next week for a new fracture that I mentioned back in November. So when we talk about lack of trust and the cost of failure and the failure of services and the cost that has, in terms of trust of us as individuals, and then the cost of the time that we've invested, the burden falls on us as carers. And what I'm seeing right now is that burden on me is increasing to a level where I've got 6 complaints in about, 4 about Haringey, 2 about the ICB and 2 about the North Mid. And they're all valid. I think not spotting a broken elbow. Oh, it's go private. I sent you in, didn't send you in. Cost me about £2 grand to go private to find out what's wrong with him. and I can afford it, others can't. Talked earlier about Somali residents. How do they negotiate this mess? It's difficult to do when you're English with 3 degrees. It must be impossible if you don't have the resources around you.
No, it's and I think what I'm hearing from you, and correct me if I'm wrong, is that when there is a more complex situation, rather than, you know, you're talking about a huge different array of services that you're coordinating with alongside for the young person that you have that huge responsibility obviously for as part of your family. And I think, so the question that I would ask, so Kerrin, if it's possible to answer here today, is that when there is a more complex situation, and maybe that this process isn't just, oh, you do the OT, then you do this, then you do that, it's sort of, is there any remit? What happens in that situation? Is there any sort of ability for the council to adapt and have the resources to adapt its approach, and maybe take a different approach when it's a more complex scenario?
So my understanding, so I've only been doing this element for two months, but my understanding is that there are meetings that are normally held with the family and workers, and any other organisation that's involved in trying to negotiate ways around it. So I know that, you know, in particular, we do have some cases where we would prefer for the residents to be decanted, and that requires bringing in, whether it's housing or in this situation, whether it's LD, and having those discussions and trying to get everybody on the same page.
It's not your preference that our family decanted, it's my preference, and Councillor Connors is aware of this.
Sorry, you need to put your mic on, otherwise we can't. Just press your little button. Thank you.
Sorry, it's not your preference that we're decanted, it's my preference because of the complexity of my son's disability. And we have had the meetings, but meetings were at the last meeting, and I'm almost directly quoting myself. I had to say to the people, your members of staff present, my expectation of meetings is that we have an agenda, we come together, we might have carried out actions in the meantime, we update each other on what those actions are, and then we think ahead about what the next set of actions are. Now, I was able to update that I'd made this reservation on my credit card for us to move out for. That's my cost as it stands, for £7,500. I was able to tell them that I'd negotiated with work that I can work at the other office if necessary. They were more than accommodating, very nice people, very good with me, and Zach's caring and responsibility. So I was able to take so much time off on Monday when his wheelchair broke. But your officers were not able to update me on the questions that I asked them in November that Phil from Disability Action restated in the meeting in December. I then sent them 2 days before the meeting to remind them that these were the questions that still hadn't been answered from months before. That's not my understanding of how meetings work. Meetings can't solely be for the purpose for you to tell Councillor Connor we're having meetings. There's got to be something happening in them.
So I'm hearing that frustration. I think there's a huge amount of work that obviously needs to be done off this meeting anyway. You know, and I know that it's
never about us, Councillor Connor. I happen to be particularly vocal and well organised. Yes. This is about anyone with a child with complex needs.
So bringing it back to that exact point, I think, is really hearing the frustrations that you've experienced, and you've come here tonight to sort of help us understand how this system is working. I think, is there anything that you can sort of give us at this point? I mean, obviously, without going into individual circumstances, and I've got Councillor Desneves around what happens when things don't work. Because, you know, obviously we're going to go through this as well, but there's always going to be a situation where things, for whatever reason, don't quite work or don't work. So, yeah, I think it's really trying to understand where that process goes at that point. And I've also got someone else with their hand up. I've got Mr Leveson. Okay, I'm just going to take Councillor Snez first, and then I'll come into Mr Leveson. Thank you.
Yeah, so I think Corinne can come in and tell us what happens when things go wrong. Just to also say that I don't think we should I can't call you Mrs Leveson. Sue, can't do, it's just weird. Sue will appreciate that we won't comment on Sue's case because it's a live LGO ombudsman case, so we shouldn't do that. Appreciate the context in which it's being shared, but just need to emphasise that. It does feel to me like there's some things here that I would like to pick up with the team outside of this meeting. So I think, Chair, that's probably what I would make as a commitment to do. But perhaps Corinne could come in and talk about when things go wrong, what the process is, please. They're of real interest to us too, because we're trying. Sorry, I just feel like I want to come in. Sorry, I know we shouldn't be doing to and fro, because we're trying to drive, and we feel that in the borough there are real issues around that, and around people's real lack of access. But I mean, I've discussed that with Councillor Connor before.
Okay, thank you. I'm just going to remind people to put their mics on because it's otherwise people who are online can't hear us, what you're saying in the room. So I've got Karen, just to sort of, or John, I noticed you came in. It's just really around what you do when things aren't working and what the process is. Thanks.
So I am new into this, so this is something that we are looking at in terms of processes with situations like this and making sure that we have processes of how it works. And it's all about learning from what's going on currently and being able to navigate that and find a way forward.
Yeah, just to add to that, obviously, you know, part of the reason why we're taking all these actions to improve things is because things haven't worked terribly well. But where obviously this is quite a complex case, and I'd be interested to actually be involved to take it offline as well and just pick up some of the issues, those 4 complaints around social care. I know Andrea's involved, so I mean we can pick it up then. But I mean, like anything that doesn't go right, you know, we put an improvement plan in clearly, you know, to make sure that we learn, as Corinne said, but also we make changes to processes and systems. And actually, I mean, I think the point you made earlier about communication, I think, you know, we're back to that kind of really important bit, isn't it, in terms of keeping people informed and actually responding to the issues that they raise. So we haven't got to the bottom of it yet. There's still work to be done, but clearly, you know, that's what we are doing at the moment to try and kind of put things right where they've gone badly wrong.
I'm just going to ask Mr Leveson to come in, and then I've got Councillor Desnebs. Thanks.
Thank you very much, Councillor Connor. I was listening intently to the previous discussion about maternity services, and so many of those things that were said about the state of the maternity services, the lack of record keeping, the duty of candour, the communication, all apply in what we're looking at here and the problems that we're facing. And I just want to draw a couple of very general points, as I said, because we're not talking specifically about ours, but how we've been affected. We were having discussions, very detailed discussions, very useful discussions with an OT, and then that OT was taken away. The contract had ended. It was an external company. We were never notified that happened. So suddenly it all goes quiet. And then we're left to chase things up again. I was having discussions with the previous interim head of service. And then that person left. And we were left not knowing that. And again, waiting for follow-up that never happened. And I actually have a feeling of dread when I think it's Corinne talks about being the interim head. Oh, she's only been here 2 months. She needs to pick up on things, follow what's going on. Because one of the other elements of that previous discussion about maternity was how they use patient voice as the memory of the organisation. And the thing is, we've talked about all of that before, about the memory of the organisation, and that we, the users of the service, are the memory of the organisation. But we're left stuck with kind of no knowledge of what's going on. And you know, John just now talked about, you know, oh, it's new and we're trying to improve things, but, you know, this is following on from scrutiny in 23, 22. These aren't new, but it doesn't seem to have moved on. And I can't see any evidence that it's moved on. And I'm trying to understand at what point, you know, they think things will have changed, where it leaves us, certainly as individuals, but the wider community. Because, you know, as Mrs. Levison quite rightly said, that we can advocate, we've got some good supporters with us, we'll put forward our case. But for many, many others, you know, when we're talking about the cost of living crisis and all these other elements, those additional costs and burdens fall on the individual. And I think it has to be recognised that that is the state this service is in. And I'm not seeing that change. Thank you.
Sorry? Okay, I think actually, I mean, I think I managed to hear most of it. Apologies, I think the quality wasn't great. So I think just apologies if I didn't capture everything there. But I think, you know, I think I would say that actually, you know, the officers here tonight are looking to address the issues that we have brought up with your help as part of the scrutiny. And actually, you know, I think officers obviously can answer that, and I think taking it offline in your specific case, but I think from a wider scrutiny perspective, I think it's really helpful to understand the issues around communication that are still ongoing. And I think I'm hearing about advocates, which is the action that we're getting onto as the next one. So I am just going to move us on to the papers, just because I do think we do need to get through the process. But I have heard what you've said, Mr. Levison, and I think that has been very clearly heard this evening. And I think, you know, I think the recommendation from the committee following this will be understanding how more complex cases are dealt with, but, you know, taken forward and supported, because I think some of these, you know, seem to be, well, if it's working, then it's going to be, it will hopefully work well. But in situations where there's lots of different needs and sort of services involved, I think there might be a different process that might need to be looked at. Now, I've got Councillor Desneves, and then we are going to have to go through page 61 to the next point. Otherwise, we aren't going to go through this. And then I will take questions from Councillor Mason and Councillor Brennan, but on the advocates bit, because actually I think that's really important, and I think we really need to get to that bit. But Councillor Desneves.
I'll be brief and say two things. The first thing I'll say might be a bit unusual, which is, you know, John's right. We've heard communication, but if I was at Sue, etc., I'd be really pissed off and frustrated, because actually we've talked about communications before, and it's simply not good enough. So I'm saying that and owning that, and I think it's true, because complex cases are a different matter, and I have to be honest, you know, I do see a lot of casework comes directly to me, and Sue does copy me in, and I do read them, and I think she knows that, even though I don't always respond. No, okay, but and so the point, I think the point is that we've heard that frustration, and I think complex cases. So what I'd say is, I could say anecdotally, in my inbox, I see less pain than I have in the past. But I suppose what we should acknowledge factually, and it's not taken away from what Sue and her family have said, absolutely not, is that in that intervening period, we've halved our waiting list. That's not, you know, we came out of the pandemic with a humongous waiting list, and that is not a mean feat. And so that means there's a lot of people right now in the borough who have their adaptation, and it's working. And that's it, we've closed off those cases. So I think this combination of self-chastisement and saying it's not good enough, and communication is clearly still an issue, especially on more complicated cases where we have multiple different actors in there, but also saying, actually, can we acknowledge that halving a waiting list in that time means we've done a lot of work, and some of the things that Karina was saying around recruitment, we were sat here before saying we can't get OTs and we can't get surveyors. So I think that's the positive. That's me trying to be supportive of the work that we have done. It's not all bad, but acknowledging Sue's experience.
I'm completely accept that. Completely accept. If you've halved your waiting list, and that is fantastic. If half of the people in the borough who need support have got that support, that's brilliant. But at the same time, whilst I'm celebrating and cheering you on, 2 points I'd like to make. One is to bear in mind that if you've got a big backlog of people, the easiest people to meet the needs of the less complicated people, which might push those of us with more complicated needs a little bit further down the line. And I see it in children's services where you see an expansion of the people included, but that expansion is of the people who are included are the people of kids in mainstream, people with kids who are easy to solve. We're well aware that we're the expensive end and the expensive end of the expensive end. And that needs to be recognised as well. So that's one aspect. And whilst I was talking, I've remembered it. So the other thing that I've forgotten it again now because Beverly laughed. I'm not going to look at you, Beverly, but you've laughed now. My memory's gone. You laugh. My memory's gone. It's gone.
Okay,
just smiled. You smiled. It's no good.
Sorry, I'm going to come in here. So I've heard that recommendation, I think, was.
I remembered. It's the basics. So whilst we're talking about getting the communications right, but actually you need to keep paring it back. So like when his wheelchair was broken, or you're teaching someone, or you've got an engineering problem, or you're trying to analyse what the problem is, you have to keep going back to looking again what the next layer of what it is. Now, we've got these nice headlines about these areas of improvement, but we need to pare it back a little bit more. And I think what I've talked about is really, because it is a complicated case, what I've spoken about is very basic record keeping, note keeping skills, the stuff that Dominic has, in spades, because that's what happens in these meetings and that's how they move forward. But we're not seeing in the offices in the complicated cases. And so you go, well, what's the basic fundamental skill that's missing? And it's adequate, it's accurate records and timely responses to things, that sort of thing. Don't laugh because I'll forget.
Okay, I think that's been well heard, and I think also it would be really interesting for the committee to understand in complex cases if those delays are increasing, and I think that's what you've just flagged up. So I think we haven't got the numbers here tonight, and I'm not going to ask for them tonight because obviously this takes time, but it is really helpful to look at, and I've heard that point as well, and I think your request about record keeping and accuracy, I think, is really important, and we'll discuss that as we go through. But I am going to take us to page 61, which is the actions requested. So there's the advocates. So I had Councillor Mason and Councillor Brennan and Councillor Donovan and Helena. Okay, so this is a very popular one on the scrutiny part. So obviously we've read what you said, so we won't obviously reread this, but I'm going to go straight to questions then, and in that order, if you could just two ask, so Councillor Mason, Councillor Brennan, and then Councillor Donovan and Helena, you two people at the time, that'd be great, thanks.
Thank you, and I will be very quick. Like everybody else as a councillor, I've had numerous inquiries about adaptations and, well, a number of, and waiting for a year. This woman I've got whose husband is stuck in his room. She tries to get to work. She goes to work. He can't get out because he hasn't had the stair lift put in. And that's a year. And I've been chasing that and chasing it. So in a way, I've been the advocate. I'd really love to give it to somebody else to chase. But there's those kinds of things which aren't very complex. It's not just complex cases. It's also people knowing how long do they have to wait. Now, if that woman had known it was 6 months, she probably would have been very patient. If she knew it was a year, she might have been a little less patient. But she doesn't know how long it's going to take, so she's very frustrated. So my ask is that when you do the assessment, that you tell people an expectation of the length of time, and that would be just like you do if you're going to go and get your eyes tested or something else, so that and that really helps people. Thank you.
Okay, so there should be a clear explanation of any delays and the resident given the opportunity to discuss any changes as well, I think. So that's an advocacy and communication. Okay, Councillor Brennan, do you want to ask your question?
Yeah, well, I wasn't going to speak on this, but I do notice that when you're talking about advocacy, you're referring people to other agencies and such like. I feel it would be more It would be really great if people actually had an individual person who sort of comes to them and is an advocate rather than being pushed off to other agencies which might be too busy. And the other thing is, as a general thing, when I read through the whole report, I noticed and I was really impressed by how many attempts there are to improve communication. I mean, all over the thing, there are loads of attempts to improve communication. So I suppose the next point is to somehow get together the attempts and the reality, to really work to get the reality to meet, because on paper it looks wonderful, but somehow it's not quite yet gelling, but hopefully it will, because on paper it looks like all the intention is perfect, I think.
Okay, so I've got the 2 questions from that. I'm going to let officers respond. Councillor, I keep wanting to call you councillor in this lesson. If there's anything you want to just add. I know. So if there's anything you want to just add very quickly on advocacy after officers have responded, that's lovely. But I'm going to ask officers because, Karine, yes, over to you.
I mean, just picking up on the points that were made, I mean, I think it's quite a reasonable request that, you know, some idea of time is given, you know, when that assessment's made. And I think, you know, we'll pick that up and ensure that that kind of information is passed on at the right point. And then I think, you know, you're quite right, you know, communication, there are a lot of things in that report that talk about we're doing all these things. I guess for us, it's about checking them out and testing them in terms of have they worked? So I think managerially, I think there's a piece of work to do there. We have a performance management team meeting every month. And I think, you know, part of maybe the commitment here could be to pick these issues up and build them into that performance report.
Sorry, and just to add to that, we have just recently created an AIDS and adaptation board where we're going to be meeting regularly and building together an action plan of things that we need to do, and regularly being held to account of those actions that are coming out of the issues that are being raised.
Okay, thank you. I'm just going to ask Phil, because I think he's on, I can't see. So I'm just going to ask if he's on from Disability Action, whether he had any comments about advocacy, because I know that he is obviously involved in that. Oh, he's not online. Sorry, I thought he was. Okay, sorry, I thought somebody told me he was. Okay, I misunderstood. So I shan't ask him, but I can email him. Okay, so that'd be helpful to get his input on that. So I've got Councillor Donovan and then Helena again on this area.
Okay, just on this point of advocacy, which I think is very important, that people do have an ability to be able to talk to somebody independent, and as it said that they can be referred. There's a number of organisations listed here, but I suppose our job as councillors, as politicians, is to make sure that those are active and well resourced, not necessarily from the council, but make sure that they get access to other funding. And I think that's one of the things that maybe develop out of our strategic partner, our new strategic partner, who's going to be building on capacity for voluntary groups, because we are. As everybody always says, we have a lot of voluntary groups, but we can't expect them to do anything without resources. So that idea that people will be, they will be given that option that they can go to somebody for independent advice, and also that they may be able, if there's things that go wrong, they may be able at key points to remind us. And I think the point that you made about the number of cases, you know, you can say there's 200 cases waiting and then it's down to 90 cases, but are they the 90 most difficult cases? The advocate could, you know, keep reminding the council about that case, but also again, it's our responsibility as councillors to make sure officers, the services, and you know, put pressure on the national government to make those resources available, so that officers don't just deal with the easier cases, which they want to deal with the more complicated cases, but we know that they need time and they need resources to do those. So I think this is a very key thing. in this report, and I'm glad it's happening. But I think what we need is for you, the cabinet member, etc., to say, is it happening? Are the voluntary organisations, do they have the capacity to meet this need? Thank you.
Very important question. I'm going to take Helena's question at the same time because we're doing two at a time. Could we take two people and then yeah, otherwise, thank you.
Sorry, Lucy. Right, so mine's more about the procedure. I'm really concerned about advocates, for instance, that are family and friends. And I want to understand, number one, do you record it electronically? If it's recorded electronically, where in the notes? Has it got a separate field so that as it passes from person to person, they can find it quickly and that advocate isn't lost in the body of the notes? Because it's really hard to be a family or a friend and find that you're actually not recognised because it's got lost somewhere. So I want to understand the procedure. Have you actually allocated a separate electronic field? Is it recorded electronically? Sorry, I'm being very detailed.
No, another excellent question. Right, now over to Beverly and then obviously John and Kerin to respond.
Thank you for the questions. I'll leave the technical recording field question to Corinne. I just wanted to respond to Councillor Donovan. We actually commission the advocates, so they are paid. It's not that we expect the voluntary sector to act as advocates. Voiceability is commissioned by us. Disability Action Haringey is commissioned by us. Community support workers are directly employed by us. And Power is commissioned by us. So I just wanted to make that clear.
Yeah. In terms of the recording, we now use LAS, but on the main contact page, there is an element where you put in like contact details, and that is where you can put in the main contact detail of the main person that needs to be contacted with regards to that case.
It will say, sorry to persist, but does it actually say advocate next to the contact name? I mean, how does somebody who comes in new because somebody's sick, how do they know? So that's what I'm after.
So that you would write in advocate in terms of the relationship. That I don't know off the top of my head. It should be done, but yeah, that's something that we can definitely look at.
Why don't we deep dive it and find out, and we can answer the question. And I was going to say the answer to this is the data. Exactly, is do the data. I wanted to, sorry if you don't mind, Chair, I wanted to respond to Kathy's comment earlier. I think actually it's really important because we do have a policy in the council where we can to have something in-sourced and directly employed by us. But there are situations in which people I sense that Sue really appreciates that relationship with Phil and that separateness. And there are quite a lot of services that sit in my portfolio that we think we'll never do that with because people want that independence. It's really useful. And also those organisations play I think what Sean's alluding to is they play another role in the community and society, which contributes to how they help individuals when they're commissioned by us. So I think it's really important to say that. Connected Communities obviously is a council service, and you would have, I have individuals that I know who work with Connected Communities workers, and they'll be working on all sorts of different aspects. Could be PIP applications, it could be etc, etc. So some people will have that support, and it will be through someone who's employed by the council. But there are lots of other situations where I think an independent advocate is the thing that's needed and the thing that people will want and trust.
I'm going to bring you back in because I did say I was going to, but I just want to double check on capacity, which Councillor Donovan, I think, brought up earlier. So within the organisations, understanding that the council pays for the advocates, have we got enough people within these ones that have been highlighted here tonight? Have we got enough people who are advocates, or are you finding that people are asking for advocates? Or being offered advocates, but actually, I'm just going to take voiceability because it's the first one on the list, and they say, I'm picking numbers off the top of my head. We're already looking at X number, helping X number of people. Actually, in order to do that, we need X small number of staff, Y number of staff. So, I mean, I don't know what the feedback is from these organisations to yourselves. Thanks.
At the moment, that's not something that's been raised.
Okay. So when people are offered advocates, everyone that's been offered an advocate and they've said, yes, we want to take it up, that's been processed and that's happening.
In terms of from the OT adaptations at this time, yes. And just sorry to go back, so we've checked, and on LAS, there is a relationship that specifically says advocate. That's on there. So when they add someone and their relationship status, whether it would, be husband, wife, there is also an element for an advocate to be added.
Beverly?
The only thing I wanted to add is that very often, in many cases, people choose to use a family member or a relative. So I don't think there's a significant call on advocacy, just to note that. But we've just seen that it is recorded. Thanks.
It's just useful to know that there's the capacity within the service. Mrs. Leveson, you...
I mean, we're supported by Phil at Disability Action Haringey. I mean, I've really got the same concerns that have been expressed, amongst the group, which is he supports us. You're talking about half a day yesterday, because that was how long the meeting was. He phoned me in the evening, that's half an hour. He's included in emails, and he emailed me on Monday. Now that we're one family, I mean, I don't know what the capacity there is. I don't know what the funding is there. Because you think about it, if someone like me, if they're all like me, or me and Zach and our family, he's got capacity for 10 a week and nothing else. And we know he does other things. He supports the council in other ways. And then the other thing is just, I wholly agree with you that it's important that he is independent of the council and that he's separate and that he's not seen to be part of that. But for God's sake, fund him properly.
I've got Councillor Snev.
You're channeling Phil. He doesn't need to be here. I think there's a good conversation. That's a good question around organisation sustainabilities, but you won't be surprised to hear that that's a conversation we have with organisations that we commission. And I don't think I'm betraying any secrets to say that that's an ongoing conversation with Disability Action Haringey, as it would be with any partner organisation that we commissioned. And you're right, it's about all the different things we might call on them to do, and all the different ways in which we can support, and a new, as Sean says, new voluntary sector partner can support too.
Right, well, thank you. So we've actually got actions requested by Scrutiny on page 62, which is key communication about confirmed in writing, so that the residents and family has a record of this. So the update that we can see on our papers. So it says you've compiled a comprehensive information pack which details the process should a resident wish to pursue their own schemes. The occupational therapist provides residents with a copy of the OT specification, sign off and approval, and surveyors also provide a copy of the drawings which were requested for works to commence. So that's quite a specific number of different areas that are happening. So if you're going to be increasing, you're getting extra surveyors, and you've got 2 and you're getting another 3, you're getting more OT, occupational therapists. I keep reverting back to the acronyms. Are you actually, with the extra 100 more people that you're going to be doing, was it a month? That's a significant amount. How do you think you're going to be able to sort of process all this in that time frame? Will you have the capacity to do that?
Well, this is part of the process. So once an OT does their assessment, it's their responsibility to then send out the assessment and the support plan. Once it then goes to the surveyor and they've done their plans, they then need to send those out. So it's not something that's going to be separate to the process. It's within the process.
Are you having any issues with this at the moment, or is this working as you've got it set out in the pack here? How are you finding it currently?
At the moment, I think it works in some aspects. But I think from some of the comments that has been raised by Mrs. Leveson, I think it's evident that although some areas are working, there's still some areas that are not working, and we are striving to make continued improvements.
I'm just going to ask if members have got any other questions on that. I've got Mr. Leveson's hand up on the screen, and I've got. Do you want to come back in after that? Okay, so I've got Mr. Leveson. Do you want to comment on the key communication aspect?
Yeah, can you hear me okay this time?
Well, yes, I'm not hearing it brilliantly, but I can hear you.
Okay, one moment.
Technical support here saying, were we saying move, take your phone off speaker, apparently.
Let's try that. Is that any better?
Yeah, that's much better. Thank you.
Okay, right. So one of the things that was just said, and I want to make sure we don't gloss over it, is that the OT, it's up to them to write their report, do their specifications, and send it out to the resident. What process is in place to ensure that that happens? What is the recording mechanism that means that if that doesn't happen, and what timeline is there for that to happen after an OT visit, that says that when an OT is visited, no more than 7 days later, that specification is sent out, and if that doesn't happen, there is some automatic trigger, some follow-up.
Thank you very much. Very good question. Karen or John?
So that's something that's been recorded on Liquid Logic, and it's in terms of clinical supervision. All therapists get their supervision once a month, as does the surveyors, and they go through each of their cases, and that's something that's picked up. So once they've done the assessment and they've sent out each relevant document that needs to be sent out, that is recorded on Liquid Logic, on LAS.
Is there a specific timeline within that is expected to happen?
In terms of the process, that is something that we're still working on with regards to working out the timelines.
Okay, so I think for scrutiny, I think recommendation of this committee is to understand further, once you've got that process, what exactly that timeline is and what will happen, what happens when that trigger, is there a trigger then that flags somewhere that if it's gone over 7 days or whatever the time process is, where does that then go to? I've got John, and then I've got, is it Councillor Donovan? Did you have your hand up?
I was just going to say that's part of the management reports that can be generated, so that can be picked up in that performance monitoring that I talked about earlier.
So you're saying that within that performance management, you're going to be looking at the timeframes and then report back to us what those are and how that gets triggered. Okay, lovely.
Yeah, into
Thank
the
you.
performance.
Thank you, John.
And I apologise. I apologise for jumping in, but my recollection from the last scrutiny is there was like a flowchart with timelines on it that was discussed. I'm sure Mrs. Leveson can help.
I think that's what Councillor Donovan, he's got that in his hand, and I think that was exactly his question. So I'm going to let him ask that question, but I think you're same mind on that.
Yes, in this with the blue boxes, I mean, it says occupational therapist assessment 1 day, and then 3 to 4 weeks to complete specification, obtain specialist quotes, and submit to management. So within 3 or 4 weeks, it would go to the management, and presumably if it doesn't come to the management, then the management can ask them why.
And we are still working on the exact timelines of this, hence why we're doing the best day work to try and make sure that this is actually achievable.
So I think our clear recommendation is that we get that report back and understand how that is progressing. So there's quite a number of things to go through. Councillor Brennan, is there something else you want to add on this specific point?
I think that you can do it. You could have a computer reminder. Could you not have a system where you have a flash? The person who's meant to be doing it has a reminder. 3 weeks, red alert, and it goes to the manager possibly as well. Surely that would work, rather than you just having a team meeting. No?
Yeah, no, I mean, I think, yeah, that's something definitely we can look at. Yeah, I think that's doable, but let's take it away and have a look at it. Okay.
I think there's a traffic light system on LAS which we can look at utilising.
Helpful, thank you. So we are going to move on to the next action because otherwise we're not going to get through them all. So page 63, so clear explanation for any delays and the resident/family given the opportunity to discuss the changes. Name, person and contact details, we'll discuss that about provided to be kept up to date during the process. So I suppose really the question is, how is this part of this process working? So if people are waiting, how long are they waiting for? Is there sort of a point where you're sort of, as you said, does it go to the red and someone goes, okay, what's the time frames for this? Thank you.
So this information is kept on a spreadsheet, and this is where we've implemented the 4 to 6 week pathway, where we are contacting residents every 4 to 6 weeks to give them an update on where they are in the process.
Do you about adaptation or aids or both? Is it about disability?
You've got to put your mic on.
Is it about, are you talking about, the system, are we talking now about adaptions, which is long, it takes a long time, or is it about just those little aids? I need pneumatic oxide. Which one of the two is it, or is it both?
It's more focused on the adaptation process. Yeah, so just in terms of reviewing, so we have the 4 to 6 week pathway, which is where we have someone that will call someone every 4 to 6 weeks to give them an update on where they are in the process.
Okay, and is that actually able to be happening at the moment? We've got enough staff in place to sort of do this, that they can call someone every 4 to 6 weeks?
Yeah, so we have the OTAs that we've recently recruited into the adaptation team, and also the adaptation delivery manager that's overseeing and providing support where necessary.
Just a quick one. How many cases are involved in this process? What is the total number?
At the moment, we have 289 that are on our waiting list.
Okay, and you call all of them every 4 to 6 weeks. Is that what you're saying?
That's a lot.
That's a lot. Yeah.
So in the beginning, a piece of work was done. I think in the beginning there was 448 last March, and a task was taken to call everybody that was on the waiting list, and that was done. And now this is just a preventative measure that we now do off the back of that.
Okay, thank you. So just very quickly, when they're calling to update them, are they calling to give them any change in information, or is it mainly people's just saying you're needing to continually wait? So think about percentages of the conversations. Are 80% just saying, look, you're continuing, there's whatever reason, or is it more about actually think something's going to happen?
So it's about updating where they are in the process, but it's also an opportunity to review. So as you know, everyone's, your needs change. So it's being able to review where they are at this time, whether or not they need to be prioritised, and having a look at that.
That's clear.
Yeah. So, I mean, to build on what other people have said, it's about record keeping. I personally do not like being rung on a mobile. Part of that is because I know from previous complaints, if I'm rung on a mobile, there's no record of it. Whereas if you're rung from your landline, it automatically records. Additionally, my preference is always to be contacted by email, and I don't know if that's given it. For me, it's important to have an audit trail. I think you've worked out we have a lot of things going on, not just with the council, but with other services. And in order for us to have adequate records to reflect on them, to make sure we've not misunderstood, that audit trail is essential for his ongoing care and his safety. So there's just a couple of things around that, really. But I object to phone calls being made on a mobile when no records kept of them.
Okay, so that's a really good point about, and I suppose we, as a committee, would like reassurance that the conversation that is being taken in that phone call, where does that get updated? Is that literally inputted onto somebody's file as someone speaking? How does it work?
So that is recorded on their case file on Liquid Logic.
If somebody said, actually, could you send me a copy of that? Is that something that we can currently do?
Yep, so that will be sent as an email, and that email will also be uploaded into their file on Liquid Logic.
Okay, right. Okay, have you got any further questions on that? Yeah, I've got Councillor Donovan and then Helena.
Yeah, just following on from that, I assume that if somebody is phoned and they say, oh, I prefer to be phoned on my landline, or I prefer you to email me, then obviously that would be respected. I'm sure that would be.
So just to add that, on Liquid Logic, on the personal details page, it does have specified the preferred method of contact.
So my question's about recommendation number 5, which is still on the same page. This is a named person and contact details should be provided and kept up to date. Nowhere in the body of this do I see an answer to that. So I just want to be reassured that that is happening, because it's not in your reply.
Yeah, that is happening. So once an OT goes out, they are made aware of who their OT is and contact details. And once that involvement ends and it goes over to a surveyor, they're also being given the same information about the surveyor.
Okay, so we're moving on to the action 6, that suggestions made by resident family should be recorded on the case file and treated in the same way as those from a professional staff as the resident family experts in their own case and situation. So we've got the current update here. Now, I remember this can be quite complicated when there's sort of differences of opinion on how this progresses. How does this work if a resident has very specific requests, but actually somebody comes in and says, well, actually that won't work or that doesn't fit? Do you bring in somebody else then, almost like as a not mediator, but someone who can sort of look at, both sets of ideas and work out how this is going to work?
Yes. In terms of, we have kind of like panel meetings where we involve, so initially the recommendations are between kind of like the client, the OT, and the surveyor. And where we have these discrepancies, we then bring in kind of like a panel, which then includes the managers above that in terms of the adaptations and OT and head of service, to have a look at those and discuss the best options, taking everything into account.
Is there a point, if they don't already have an advocate in place, that this would be a point where you would recommend?
Most definitely.
Any other questions on that, Councillor Donovan?
There's actually the other difference of opinion could be that the client wants a particular thing done, and a member of the family or a few members of the family don't want it done because of the impact on the house or things like that. And that's probably not something that you could do directly, but is there a way of maybe some sort of family guidance or family discussion that you could get somebody in to mediate between the client who may need something done for health reasons and the family who say, no, we don't want it done?
At the moment, there isn't a service like that. And I'm an OT by background, so I'm fully aware of those kind of cases. I've come across them a lot in my career, and they are very difficult ones to navigate, unfortunately.
2 sets of advocates, I think, going in there and trying to help. Okay, so we've got number 7. This is the record keeping of all delays and the timescales. Now, we've already had a discussion today about timescales, and I think we're going to get the information back and the alert triggered. So I've understood what we've asked for. Is there anything else that the committee want to ask in relation to this action on this point?
From everything that we've heard earlier, I think this is very important, that there is, if there's undue delays or if something gets lost, then there should be some trigger to alert someone to say, look, this isn't happening the way that it should be, and we need some extra resources to sort it out. And the things that you're suggesting here seem to make sense, the reporting system. Thanks.
Can I ask, do you do a duty of candor, or you apologize to residents if the delay is significant, or is there any means of compensation for residents in those instances?
Where we've had complaints and it's duly noted that it is due to our fault, then apologies are made. There has been circumstances in the past that I know of where compensation has been made.
I was just going to ask you, is there anything else you wanted to add at this point?
Yeah.
We have already heard, and I think you've been very, very clear on this, but I just thought at this point, is there anything else you wanted to add?
I mean, there is, so I made a subject access request, and what I found, because we've got the idea that we have a bazillion appointments, we have at least two or three a week at the moment. I think some of that's, that's because we're transitioning into adult services, not just in social care, but also medical care, and we're going into a post-19 provision, of which there are not enough places across the whole of London for all children with severe disabilities. I'm sure Beverly knows that already. But what I found when I read the freedom my subject access request was when we said we were unavailable to receive some cot sides, they'd just been cancelled completely and hadn't been reordered, and no one had told us. And it's because I'm quite sure it's probably because of an appointment or what. We both had to go to work that day rather than working from home, so there was no communication. That just fell through a crack in the system.
So how do you, as a service, now I've understood you said you had a new AIDS and Adaptations board. So in things like this where there's complaints being made about the communication process, obviously you want to address that particular complaint and that, but how do you look at do you do a sort of a deep dive every now and again into sort of reports about communication that have maybe been fed back to you, maybe as informal complaints rather than going through full stages of it? And at what point do you sort of look at it and think, right, okay, we need to just re-look at how we're communicating? Is this on the same point? Sorry,
it was more on the board. Just a quick question on the board. A question on the board that was formed. It's more of, do you have any lay partners on the board, or is like service users on the board as well? You know that the adaptations board that you just set up, do you have any service users on the board that's on the board as well, or is it just council staff and people that are outsourced?
The board is very new. So we've recently just set it up, and one of the meetings that we've recently had is around the terms of reference for that board and trying to establish who's going to be involved, what different departments within the council, and at what stage different people are going to be involved. So at this stage, no, we don't have any service users involved, but it's not saying that there will not be any involved within the process.
Yeah, I think I found when you're having these boards set up, it's important to have the service users, because they're the voice, they're the ones that actually use the system. So it's important to actually keep them there throughout, because they're the ones that can help shape things and make improvements in that way.
One of the things that has helped shape things, which I guess comes from service users but in a different way, are complaints. So it's looking at the complaints and it's looking at the themes of the complaints and looking at ways that we can rectify some of the issues that are regularly being raised as an issue.
if mistakes happen, what processes do you have on the board or an internal mechanism to learn from these things? Do you have a scrutiny within internal scrutiny to learn from your mistakes, or the board challenge and ask questions?
Thanks for the question. So the board is relatively new, but more generally, we have a quality assurance board where we look at complaints, the learning from complaints, and look to see how we can minimize them happening again. But I wanted to respond to your question also around the person in receipt of care and support. And we have, before your time, Corinne, we have had a case where there was a difference of opinion between the sort of professional OT recommendation for a particular adaptation and that of the family. So the family representative was actually invited onto the panel to make their sort of holistic case known, and it came out to a very positive outcome. So that's something we will certainly consider. That was a really complex case, but we have used that in the past, and I'm sure we will consider that seriously. Thank you.
One of the sort of points just being made was around and you said this is a brand new board and it's just in its infancy. But I think it's really important, service users, and not everyone will put a complaint in because not everyone understands that process, and they will just sit at home and have a year's worth of whatever and not really know that they can escalate this. And sometimes people don't want to because then they fear that they won't get anything. So, I'm really aware of that. People dare not complain in case they get a door shut on them. Now, I know we know that doesn't happen, but I think people do genuinely have that fear. So I think it's really about within this whole process, and not just around the Aids and Adaptations Board, but I think because we're looking at co-design, we're looking at how we involve service users and how we involve our residents. So I think one of the challenges back to yourselves as as this process is how do you actually get to hear voices that you may not necessarily, and through the complaint system here. Because there'll be some people that are able to do that, but there'll be a lot that won't. So how do you sort of get any feedback around what's going on from other people, and how does that feed into the board or any other part in order to, as you say, go through that management bit and understand quite what's happening more widely?
So one of the actions that was set by Janet, who I've taken over from, that hasn't been able to happen as yet, but we still want to work on it, is about doing a workshop with residents to have a look at the resident journey, some of the issues that they've encountered and how we can improve things.
Okay, so one of the slight things I'll just push back on workshops is it's great people come along, but then they don't necessarily get feedback of what actually changed as a result. So I'm just going to say, and I hope with the support of the committee, that if that does happen and there are changes, it'd be really great if that could be communicated back, because I think that really helps people feel that they were engaged in that process. And that's really important. Okay, I've got Mrs. Levison with a hand up, so I'm going to take a question.
So with regard to what you've just asked to the head of service, as a resident, I'm thinking, okay, so I don't go to workshops, I haven't got time. I come to these meetings because Dominic emailed me. That was nice. But don't you have a role in that as a councillor, and councillors as Neves and the other councillors, in picking up, not just in your casework, but I know both you and Councillors Neves very good at going to that coffee morning on a Thursday for carers. You must pick stuff up there all the time, and they're the people that you don't hear from. They go for coffee, they all chat. Most of them aren't the sort of people that make complaints. You're picking up on that. How are you feeding that back in? So and what else can be done? Because that's a nice posh one in Muswell Hill. What else can be done to go to similar meetings of people in other places? So, what role are the ward councillors playing? If you're in our ward, is anyone popping along to some, the Baptist church or the Apostles, St Philip, isn't it, on Philip Lane, that sort of thing, or there's 2 mosques on our road, popping on just chatting to people and finding out from people who are lesser heard what can be done and then feed that back.
So I think I'm just going to answer for myself, because obviously I'm not going to answer for the entire set of councillors, but I'm pretty sure that we'll feed that back through members' inquiry. So if I go to somewhere and I pick something up, either if somebody says to me, I want you to put this forward, but I don't want you to identify me, I will do that. And I'll say it's from, a resident. If somebody wants to be identified, obviously that's absolutely fine too. But I think that's really helpful, because that's a good question. That's not a complaint necessarily. It will be taken as a formal complaint, but it would be a member's inquiry into a concern raised around the service. So that's a really good point. So I think it would be really helpful for us to understand, maybe when we look at this again, how many concerns raised are you getting in this service? And that, you're right, that is from members, and we do that a lot, so that does come through. No, but I'm just saying it's quite helpful.
What, as a resident, what's happening there proactively from councillors going out and finding out about stuff, because that's how you're going to get from the lesser known voices.
So before Councillor Dusneves comes straight in, I've just been given this by Dominic. So unfortunately, because we've had such an interesting meeting, the time is ticking on. So I do have to say that there's a 10 o'clock motion will be required.